We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
You're watching The Link with Chris and Sabrina on TV 11, but don't leave yet because we're coming up next on CBS This Morning.
Sinya uli di sombranza mag e zuita saluda antes di niga Radzaudzan malakes frezas durante todo el memu a no distancia como kupugi palu zaniman malak guafi con una sughiairi preba tu la noci nai banderata gaigi pues atan fanni bandera kau esta pagua pumalapa giluk tanu man libri centamiti man ko badi.
You're listening to The Link with Chris and Sabrina on Breeze 93.9.
Original music, ladies and gentlemen.
Right now, you know the mood is rigging. You see, you're all a temptation, a positive statement on what is good. Don't like the groove too fast. See me like it nice and slow. With a skanky little bassline that'll make you move your waistline. So show me, oh, you know, na 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 rock steady. Said, won't you rock steady? Oh, come on, rock steady. Oh, love, rock steady. Come on, rock steady. Said, won't you rock steady? Oh, please, oh, rock steady. Said, won't you rock steady? Come on, no.
Let's get on the dance floor, move your body left and right. Hold you so close, and girl, I hold you so tight. Feeling on your curves and all over your waistline. So yeah, I'm feeling tonight. Girl, you know you got me in a trance. So hypnotized by the way you dance. Oh, you got me feeling like I had no chance to be your one and only romance. So for now, alright.
Steady. Said, won't you rock steady? Oh, come on, rock steady. Said, won't you rock steady? Come on, rock steady. Said, won't you rock steady? Oh, love, rock steady. Said, won't you rock steady? Come on, no. Ooh, yeah. Hey girl, how you doing tonight? Skin tight.
All right, let's go.
Good
morning, Guam! Kahula. Wipe away the Mungo. It's the Link on the Breeze 93.9. Good morning, Sabrina.
Good morning.
Good morning, Harmon.
Good morning, Zero Down.
Good morning, Smurftown.
Good morning, League One Terrace, Marianas Terrace, Fern Terrace.
Good morning, Tacoma, Washington.
Good morning, Bardstown, Kentucky.
Good morning, Baza Gardens. Good morning, Toto Gardens.
Good morning, Pennsylvania.
Good morning, Roberto Fracassini. I say you forget about it, coming from the Italians.
Good morning, San Diego.
Good morning, Las Vegas. Cha-ching.
Good morning, Oklahoma.
Good morning, Connecticut, Waterbury.
Good morning, Malolo.
Good morning, Agate.
Good morning, Santa Rita.
Good morning to Orlando. NBA players, shout out, Bubble.
Good morning, Afami Sinanya.
There you go.
Is that it, guys? Come on, guys.
Good morning, Ordot.
Good morning, Macha Now.
Good morning, Manengun. Good morning, Pulanta. Good morning, Jotnya.
Good morning, Batulo. If you want to take the shortcut to get all the way to Isangsang Road from Jigo.
Okay, you win, Jay.
See, that's when you know Dedido really, really well. If you know all those little side roads and everything like that, you can get through the big village really, really quick. Just take those little Batulo roads and everything. You're good to go.
Good morning, Alligator Highway.
Oh, nice.
Good morning, Gazzanero Road.
Oh, I got one. Good morning, Bellow Road, where you used to be able to make a left turn.
Good morning, South Windsor, Connecticut. Hey. What?
Yeah, I'll take that.
Is that how the Connecticutans
Good morning, Greenwich. Not Greenwich, but Greenwich.
Good morning, Dedito. Good morning, Tamuni. Good morning, Barragata Heights and Florencia Villagomez.
No, hey, good morning to all the Guam kids who call Guam their home but are now over in the States in school. You guys be safe.
Good morning, Lacey, Washington.
Good morning to all. Good morning, good
everybody.
afternoon to all of our servicemen who are deployed all over the world. We love you guys.
There you go. Jay just wanted to shout out all the servicemen out there.
There you go.
He's available. You check him out on Grindr. What is it? At Jason Stay Grinding.
Swipe left, please.
Swipe left, Chalu. Okay, so good morning. We just want to say good morning. That's all. So everybody else that we didn't mention, good morning on you.
Wait, I've got an idea, right?
Yeah.
Okay, if I mean this is completely off script.
Good morning, Nevermind Road.
There you go. Okay, not on the rundown, but Joseph, what camera are we on? Okay, so I was hoping you guys can do us a favor, everybody out there, and remember, we love you guys watching the show. The show would be nothing without each and every one of you.
Good morning,
appreciate your
Umatic.
contributions. But doing this show, there's like a bunch of us on the crew right here. We got Chris, Sabrina, myself, Joser on the ones and twos, and then Ken Sanity over here, Ken St. Nicholas. Doing this show, we burn a lot of calories. Brain power, does get you. So we're kind of hungry, but everybody's got to stay home. Everybody's got to do the responsible thing, right? I'm asking, can you guys in the comment stream, please, make us breakfast this morning in emoji? All right, be as creative as you want to, but you can only use emoji and put like a little breakfast meal together for us. That would mean the world to each and every one of us, because we can't just live on coffee for 4 straight hours and everything. So emoji breakfast, if you guys wouldn't mind, that would make our day, please.
No, if you guys want to make a real breakfast. Man
Never
does not.
mind the emoji.
Yeah, I don't need emojis, bro.
Well, okay.
Grab and go. Order that. Grab and grab.
Right, just send it over. You can do it. You pay with your card and then send it here.
Okay, so much for the payola rule, but
I'm just saying.
okay, but I'm just asking if you guys want to make like pancakes and bacon in emoji and like put that in your comment, we'll feature them on our comment stream right here on the video. But yeah, thanks a lot. And these two apparently.
Hey, good morning,
Really
Joey
like
and Vanji Gogui, who are exercising from Aston Park. Is that physical or mental exercise? I like to do both at the same time.
You know what? Shout out and good morning to all of the Chamorros in San Diego, in Portland, and in Seattle, because there are a lot of our fellow Guamanians on the West Coast. So you guys be safe too.
Ken Paulino, good morning. Bilambina Street.
Good morning to my brother Patrick watching in Las Vegas. Love you.
All right.
Annie St. Nicholas, good morning from quarantine. Annie, good morning. I hope you're up at the Deuce at 5-star quarantine. At a bunker, spam, bacon, and eggs pancake. Oh, here comes the emojis,
Oh
Jay.
yes, thank you. Wait,
Good morning,
There
Tokyo,
we
Japan.
Go. You can look at it.
wait, did you say spam, bacon, and eggs? Dude, that's the breakfast of champions right there. Good job, man.
There's donuts there.
Well, donuts. Okay, when it's this early in the morning, do you guys go for, the traditional glazed, the real shiny one, or like the one when the glaze actually drips over and then it hardens, or do you guys go for filled? This is key. This is a really important topic this early in the
I know
morning.
you go for filled.
I like the lemon filled with the. I know you're going somewhere with.
I know you like filled.
So we went from swipe left and being.
No, I'm a chocolate donut guy. I figure if you're going to have a donut, have a donut. Unless it's like grandma's and the sugar. Like my grandma used to make donuts and I would just be right there, the boboy. Be right there, the querido. I'll be right there with the hot donuts and I wouldn't put sugar and we'd have the butter, the anchor butter, and I would just butter up those donuts as they came out of the oil. That is how you have a donut. But rest in peace, Grandma.
Sabrina, are you more of a traditional, like the circular donut person, or do you like the bars?
The traditional regular circle donut kind of girl.
Or we're going to go twisty.
But unless I'm in Vegas, then I'm totally the pink box donut.
Oh no, wait a minute. Okay, and I'm within striking range, so I'm gonna choose my words.
If you're in Vegas and you know what pink box donuts is, then
I'm gonna
you
choose
know what
my
I'm talking
words
about.
carefully now here, you guys, because Sabrina is a woman of distinct taste.
What?
But she doesn't. I'm gonna say this.
I'm just a
tactically.
regular girl. Know what
She
he's talking
does
about.
not mind the bougie donuts. All right.
What?
Yeah. No, I remember when we went to the Philippines, Bree. Bree was getting like these guys, they go crazy on the crispy, what is it? Krispy
Krispy
Kreme?
Kremes.
Krispy Kreme.
Yeah, they have like Kit Kat donuts and they stick in like a Reese's peanut butter cup in there. And they make donuts at Krispy Kreme. They're like, hey, go buy 20 candy bars and chop it up and put it in here.
I don't like Krispy Kreme.
Okay, Fruity Pebbles on a donut has been a thing for a while. That's good.
Can I tell you guys my donut story now? Because Bree's got a little something. I wanted to get us donuts the other morning. So I pulled in up at a Crown Bakery, and I called in because they weren't. Well, I thought they weren't accepting because it's all curbside. So they told me that in order to get us donuts, I had to tell them what donuts I wanted, and then I had to pay over a credit card through credit card, and then they would bring it out. But, your boy, not really credit card status, so I was like, oh, okay, never mind. But then I found out they got it. There's a bunch of inspections that Public Health did for Department of Environmental Health, and they do these like coronavirus inspections, Bree.
Yeah, they do. So Public Health or Division of Environmental Health, they do COVID-19 inspections, and so they provide them to the media. And there's actually a lot, and these are inspections that were done from August 18th all the way through, looks like the 21st, 22nd. And there was actually one for
Crown Bakery.
Yeah, there's a lot on here.
Right.
That they inspected. So Crown's Bakery was actually on here. This was the one in Jigo. So this was on August 22nd, observed to be accepting walk-in customers. They corrected the violation on the spot by providing curbside services only. But a lot of the businesses that have been inspected by Public Health and Division of Environmental Health, some of the violations that were noted were that they failed to have a policy in place for frequent cleaning of all surfaces, failed to have and present an organization-specific guidance plan in place, failed to adhere to requirements outlined in public health guidances. So those are some of the typical violations that are cited. And then in this latest report, a lot of them are closed for PCOR 1. But yeah, it's pretty long.
Wow.
I think we could post these on our website if you're interested in seeing it. But these are the COVID-19 inspections, and then they have the regular sanitary inspections. That list I don't have in front of me.
So that's kind of alarming that they're doing COVID-19 inspections and they're finding out that restaurants where you're getting your curbside and takeout aren't sanitizing as often as they should be.
Or they're not following like the proper guidelines.
Yeah. So I guess in that Crown Bakery thing, they were caught accepting walk-ins, and they corrected it on the spot by telling like, hey, get out of here, turn around.
Could I say something?
Yes, Jay.
One thing that is sanitary, for those of you just joining us and everything like that, we made an ask of our own. We put out, can you guys make us breakfast in emoji? Share with the entire community. Everybody in the comment stream can partake of this. Carmencita Peneranda, she's got a great one. She's making us coffee, pancakes, waffles, but then she also gives us the smiling emoji with the 3 hearts, the thumbs up, and then the heart. So it's food and love.
How about Araceli Babauta's breakfast? Hamburger, hot dog, taco.
There you go.
Burrito, salad, grilled cheese, ramen, and 3 cups of coffee.
You know what? That'll get us to 10 o'clock.
Yeah, that'll get us to next Tuesday.
Great job with the emoji breakfast, guys. Okay, we've also got knives.
So excited, Jay.
Knives, sushi, and soup. That works.
Lester put frittata.
Wait,
pig's feet.
Is there a frittata
he
emoji?
put pig's feet and rice.
I seriously doubt it.
Okay, now for those of you who are more health conscious, we're being self-conscious now. For more health conscious, Anthony N. Kitagua says, Buenas from Alexandria, Virginia, and here is his emoji breakfast. He's got banana, watermelon, purple grapes, an apple, a pineapple, and then a peach.
It's healthy.
That is, yep. Got to eat your vegetables, guys.
Okay,
and your fruits.
Wait, what exactly is a continental breakfast? Is that a little bit of everything? I never understood
that's like
that.
Pastries.
Yeah,
Pastries
it's like
and
a
fruits.
croissant and a melon.
Yeah.
I don't know. Whatever a continental breakfast is, it's never enough when I get it. That's what I know.
Oh. Good job on the emoji breakfast, you guys. Keep them coming.
Thank you. 627. That is Jason Salas. Yes, we got him a microphone.
God help us.
Oh, Lord, man. Well, hey, filler. Be on standby, KJ. 627. It's the link on the Breeze. 93.9, of course. Sabrina Salas Mentanani. Good morning, Bree.
Half a day, everybody. Ready for the news?
Yes, let's go ahead and jump right into it. At 626, let's do our link news update from the KUAM news team. Jason Salas, good morning.
Here's your Guam news update. 32 Guam Memorial staffers have tested positive during the second surge of coronavirus, and the administrator says federal help in the form of critical care nurses and doctors can't come soon enough.
As the investigation into whether or not a nurse caught COVID while she was a patient at the Guam Memorial Hospital continues, Hospital Administrator Lilian Posadas says the data shows GMH patients are safer than their stateside counterparts. Posadas saying the rate of COVID infection for patients and staff in U.S. hospitals is significantly higher than Guam's.
And it's not an uncommon incident.
Right.
So, let's not panic about it. Let's not go, oh my goodness, the hospital is not doing enough. Well, look at the data from the time that we started taking in COVID patients to now. One incident,
Right.
one person. So, let's not scare the community.
Yeah. Marnette Agabao, a GMH ICU and ER nurse, did not have COVID when she was admitted to the hospital, but she was listed as the island's 8th COVID fatality last week. Posada said Agabao could have caught COVID from a visitor, and the incident is currently being investigated by the hospital's infection control team. Meanwhile, GMH staff have been hit hard by the coronavirus, with Posadas saying during the first wave, 12 hospital staff tested positive for COVID-19. Now, during the second surge, the number of infected hospital staff has almost tripled.
There's actually 32 employees. In this second wave, there are 32 employees, including some doctors who have now tested positive. So, that taxes our staffing situation because these individuals have to be out, they have to be isolated, and we have to give them time to heal and to recover.
So that means the hospital's infection control team has its hands full with full-on contact tracing underway.
The infection control team is making sure that if that staff exposed certain patients and even the co-workers within that area, they've been followed up and, fortunately, none of them have tested positive.
Posadas saying the 32 staff who have COVID are a mix of clinical and non-clinical staff. With the coronavirus sidelining nurses and doctors, she says federal help in the form of DoD critical care frontliners couldn't come at a better time.
If we can use all 15 in the emergency room and ICU, that will be tremendous because then at least we can open up more ICU beds.
Posadas adding of the 42 COVID patients at GMH, 6 are receiving ICU level care with 3 of those patients on ventilators. She also addressed calls to move non-COVID patients out of GMH and to GRMC, saying the private hospital can start by taking the public hospital's non-COVID telemetry patients. For Guam's News Network,
We'll see you online at KUM.com.
As for the latest numbers released last night by the Joint Information Center, there are 47 new positive cases. Guam's total COVID case count is now 1,494. Of those, more than half, 828, are active cases. 653 are recovering. There have been 13 deaths on Guam. 45 people are hospitalized at the Guam Memorial Hospital. 8 of these individuals are receiving ICU level of care. The COVID case count in the CNMI has gone up after a sailor deployed to Tinian from Guam tested positive for the virus. The sailor is part of a team of Navy Seabees supporting a survey for the Tinian Port construction project. According to a media release, the sailor was identified by travel screening and tested on arrival. The individual, along with close contacts, were transported to Saipan. The confirmed positive sailor was placed in isolation while the remainder of the team and 2 sailors identified as close contacts were placed in the government quarantine facility at Kanoa Resort. We should add that before traveling to Tinian via military aircraft, DoD informed the CNMI government the CB team had all tested negative. The positive case brings the CNMI COVID case count to 57. And with more regional headlines, here is KSPN2 News in Saipan.
Hafa Guam, here are the headlines for CNMI.
To date, we've sent out a little over $53.5 million.
With $9 million projected to be sent out this week to those approved for the Pandemic Unemployment Assistance Program. Secretary of Finance David Adelig says batches of payments are sent out each week.
Usually payments are sent out by the end of the week. We make that just an internal goal. But if we are able to process earlier, then we release it as soon as we.
Once the Department of Finance receives the approved files from the Department of Labor, a payment date is posted on an individual's account. But Atalig says this does not mean the individual will be paid on that date.
PUA software solution, the online tool that they have, we pull that data to start processing payment. I believe it triggers a date on as if we paid it out. But once we receive those files, there seems to be a lot of corrections that need to be done on the file itself, meaning there's a certain format that we have to process, be accepted by the Bank of Guam for our direct deposit ACH transaction. And in order to do that, we need clean files for thousands of people that we're reviewing to get paid. And it takes a couple of days to comb through the data.
Then the funds are released. Many have seen a $0 amount from the Department of Finance in their bank accounts. Atalig says, don't fret, this is a trial to make sure the actual funds will go through.
It was a test transfer. Those that receive 0 transactions, 0.00, that means that's positive. That means it went through a proper account. And those that never received it, obviously we know it's errors that we're trying to correct.
Atalig says those who did opt for paper checks will have to wait at least 10 days after the Department of Finance receives the data, as there are specific regulations by the U.S. Department of Labor that must be followed during the printing process.
I'm Ashley McDowell.
Thanks, Ashley. In national news, President Trump and Joe Biden will both hold in-person campaign events on the same day for the first time since March 2nd, exactly 6 months ago. Both campaigns are highlighting their response to the police shooting in Wisconsin. Natalie Brand has more details.
President Trump is headed to the battleground state of North Carolina for a campaign rally 61 days before the election.
This should never happen. A thing like this should never happen.
Tuesday in Kenosha, Wisconsin, the president visited businesses impacted by rioting following the police shooting of 29-year-old Jacob Blake.
Do you believe systemic racism is a problem in this country?
Well, you just keep getting back to the opposite subject. We should talk about the kind of violence that we've seen in Portland and here and other places. It's tremendous violence.
Supporters turned out to see the president and praised his focus on violence in the streets.
People were very afraid in Kenosha. Businesses were burned down. People were locking their doors in their houses, putting kids in basements, getting their hunting rifles out because they were scared for their life.
But some local leaders say the president's visit did not help.
The situation on the ground in Kenosha had been improving significantly over the past several days, and having the president come brought more attention to that situation. We also, unfortunately, didn't hear any condemnation of vigilante violence.
Both President Trump and Democratic nominee Joe Biden are out with new ads focusing on the nationwide protests, with each candidate blaming the other for the violence.
Criminals terrorize Kenosha. Joe Biden takes a knee.
The Trump campaign has a new ad out in Wisconsin trying to paint Biden as weak on crime. The Biden ad calls for people rioting and looting to be prosecuted while accusing President Trump of spreading fear.
I believe we'll be guided by the words of Pope John Paul II. Words drawn from the scriptures. Be not afraid.
Biden plans to travel to Kenosha tomorrow. His campaign says he'll hold a community meeting to bring people together. Natalie Brand, CBS News, the White House.
Your news.
Thank you, Bree. 6:36. We'll take a real quick break and come back with more of The Link, which is brought to you by First Hawaiian Bank at FHB.com. Calvo Enterprises and ITNE right here where the Breeze 93.9. Good morning, Guam.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Your life moves quickly, so you need a card that keeps up with you.
Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
Half a day. My name is Chimamba Kwem, Tuberculosis Enhancing Disease Program Manager for the Department of Public Health. As Guam continues to deliver critical services during this unprecedented time, we must do everything in our power to protect the health and safety of our people. Continue to encourage wearing a face covering, practice social distancing and washing hands. These practices are becoming especially important as we begin to reopen our great island. Prevention saves life. For more information, please call 311 or check out our website at dphss.guam.gov.
Half a day. My name is Kathleen Hernandez, and I'm a registered nurse at the Department of Public Health and Social Services. The Centers for Disease Control and Prevention recommends wearing cloth face coverings in public settings. Don't let your guard down. Prevention saves lives. For more information, please call 311 or check out our website at dphss.guam.gov.
If you plan on leaving your house, don't forget your face mask. Along with hand washing and social distancing, wearing face masks can drastically reduce your risk of infection. Many people who catch COVID-19 can be contagious before they even start showing symptoms. The more people who use face masks, the less the virus can be transmitted and fewer individuals are exposed. When we both wear face masks, I protect you, you protect me, and we are both safe.
You're watching The Link with Chris and Sabrina on TV 11. Stick around because we're next on CBS This Morning.
Got your 6
at 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
I don't wanna watch you leave me, baby. Most of all, I just don't wanna be free now. I was just
taking you all the way down to Umatic.
I was just sitting here thinking
What's up, Michelle? All good?
of your kiss and your warm embrace, yeah. And when the reflection of a glass that I held to my
All right,
lips
Jay.
now,
Hey, you know what? Nestor Lecanto came out with a brand new episode in full Zoom. Going green with this one.
Yeah, that streamed yesterday. And of course, you know, Nestor, the focus of his show, he's got a really devout audience. People really like that because he takes, you know, Nestor covered business for a really long time. He worked at CNBC, right?
Yes.
Yeah, he worked at CNBC after he left KUM in the late 90s. He went and, worked in a bunch of different places, foremost among them CNBC. So he's got a very strong background in corporate governance, in capitalism policy, and like things like that. And, you know, he puts that all into a palatable form that a lot of people can digest, and has a lot of really good guests on his show each and every Wednesday. And yesterday he actually took a look at the cannabis industry, which is now on the cusp of just, you know, really becoming a really big thing. So he had Senator Clint Ridgell, who of course was the author of the Cannabis Control Act from the policy making side. And then he also had attorney Vanessa Williams, a good friend of ours here on the show, who is the chairperson of the Cannabis Control Board. So, as far as the implementation of that law, and they talked about a really interesting conversation, Chris, because they actually spent a lot of time looking at the black market. And they said that was a very large motivating factor for why when cannabis actually becomes a commodity here on Guam, and when it can be sold and consumed in certain ways in certain places at certain times. And they were very very specific to mention like what exactly the parameters were. They talked about the black market, and Clint was even saying, he goes, there's a black market for everything out there. There's a black market for number 2 pencils. There's a black market, of course, for fake.
There is.
Classy guys like me, right? Like Louis Vuitton, those real purses. Yves Saint Laurent, that really nice stuff.
Are we talking about people are just selling weed, so we might as well legalize it? Is that what you're saying?
Well, yeah, but then they also said there is a black market that's going to take a lot of traffic away from that. So they said they wanted to actually structure it in a way that would be commercially viable. And I'm probably being very long in the tooth about it and everything, but it's a really good interview. If you guys want to watch it, it's on our YouTube channel right now. It's also on Facebook from yesterday. So go a little bit down in our timeline, and it's in full zoom.
So they talk about the black market. Do they actually talk about the rules and regs?
Yeah. A little bit. I mean, they didn't spend too much time on the policy because, Clint was talking about his motivations on that. But, they're talking about when it is formally implemented, how they anticipate this to be.
They also kind of, Bria touched on a lot of the regulations, and then Clint kind of drew the parallel that, hey, we have these regulations for alcohol, like you can't just go buy alcohol any time of the day. And so the kind of cookie cutter, these same types of, responsible restrictions on adult use cannabis.
Okay, and one thing, I don't know if you guys noticed, for those of you who caught it when it was live streaming yesterday, I even sent a message to Nestor because I was producing that show, and Nestor's like, all right, guys, so before we, and Nestor's really, really good at, going off the cuff and just ad-libbing it. I mean, he's the best. He's a master storyteller. And he was like, all right, guys, so before we get into the weeds of like this whole thing, and you just see Clint and Vanessa just like crack up, and I even sent it, I was like, oh, that was really clever. He's like, wait, did I actually say that? He said he had no intention of phrasing it like that when he said into the weeds. And I was like, yeah, he's the man.
He is, yeah. Love Nestor. He's got your 6 with the KUM News prime time. Good morning. It's 6:45.
I miss Nestor. We haven't seen him in a while. We haven't seen a lot of the reporters in a while.
Good morning. It's 6:45. Bree, so we're doing this weekly segment now that's pretty cool.
Yes, I'm really excited about it. We've partnered with the Guam Nurses Association to provide, give us some insight on what they're doing and just some health awareness and tips like that. But, the GNA, they have been around for a long time. They were incorporated in 1951 and has been a constituent member of the American Nurses Association since 1968. The Guam Nurses Association is a nonprofit organization made up of 172 members, including a set of elected and volunteer officers. So they, like I said, they've been around for a long time. The general purpose is to work for the improvement of health standards and the availability of healthcare services for all people. And joining us today, our very first guest from the GNA. Do you have... Oh, excuse me. Let me just take this
From
off.
the GNA?
Yeah, from the GNA is Dr. Margaret Hattori Uchima. She's the Dean of the OG School of Nursing. She's a longtime GNA member and the 2019 GNA Nurse of the Year awardee. Woo-hoo!
And look at her smile. She's ever so humble. She's like, oh, you guys, stop.
Stop it some more.
That was a total setup. I had no idea I was the first one from GNA.
Wow.
I'm going to get those officers. Suzanne didn't say that. Oh,
Yeah.
great thing.
And so, I wanted to thank Suzanne Lobaton. She, I reached out to her last week, actually a couple weeks ago, and
Right.
then things kind of got really, really busy with COVID, and then I was like, oh man, I gotta reach back out to her, and then man, as soon as I responded, she was so quick to line up interviews, to set this up, and Suzanne is also the vice president, by the way, for everybody of the GNA.
And
so thank you so much, Suzanne.
And I think it's so cool because we have doctors on all the time, and I feel like we've been missing that nurses' voice, and we do try and get the nurses, but you ever been to the clinic? Who's doing all the work? I mean, no offense on the doctors, but it's the nurses. So
yeah.
Thanks, Margaret. Good morning.
Morning. Well, thank you very much. And on behalf of GNA, I really think this is a great idea. You're right. We don't. It's difficult to get nurses to come on the radio and speak. And a lot of us, we don't really like. It's not that we don't like the media, Chris and Serena and Jason. You guys are great, but we'd rather stay behind the scenes.
Right.
But when Suzanne texted me, you can't turn Suzanne down. And I think particularly our nurses have been going through a lot the last 6 months, but particularly in the last week with the passing of our colleague Marnette. And so I really wanted to get out here and speak and try to not really cheer up the nurses. That's a bad way to put it in the middle of a pandemic.
Right.
But, I really want to, let people know that I really think we've got the best nurses anywhere. I've worked in California, I've worked in Hawaii, but when I came back to Guam and started teaching at UOG, and I started working in home care, because most faculty, you don't say, I want to be a nurse educator. We've kind of fall into it. It was never planned that I would teach nursing. But when I started doing clinical at GMH, I was just completely amazed at the dedication of those nurses and the nursing assistants and all the staff there. And it's great. You've had Lillian Posadas, who also was one of our faculty a long time ago. Lillian and I were both on the board of nursing together. She was the chair and I was the vice chair. I'm so impressed with her calm and her intelligence. Great example of, highly intelligent, dedicated nurse. And throughout this pandemic, there have been a lot of, some of our mentors, Dr. T.O. Cruz, for example, who was retired and came back out of retirement to help public health at the call center. And she was in my office last night and we were talking about, she's taking this contact tracing and case investigation class that UOG's hosting this week.
Wow.
And she really reached out to GMH to see how we can assist them and perhaps our students can assist them. And so Suzanne wanted me to just briefly mention UOG's efforts and where we are with the program. And I'll tell you, it's been very difficult because, like I said, first of all, we're nurses and our heart is always in nursing. We're definitely dedicated educators, but when we see our fellow nurses needing help, we'd rather be there on the floor than in front of a classroom, or in this case, behind a computer, right? So it's very difficult. And my job is to keep us focused on the fact that we need to continue our nursing program, or we will not have nurses graduating. And sometimes I lose sight of that in an effort to want to jump out there. But I always have to bring myself back to the fact that we have a great nursing program, and we need to get our students graduated. And in fact, we have in April, sorry, I have my board here. In March, when it happened, the nurse leaders all got together, and part of our job was to figure out what to do with all our students and how could we quickly assist. And so our seniors, who were great, there are 26 of them, they volunteered to graduate early, and we had a bunch graduate in April and by May. But by the beginning of July, most of them were hired in June, but they were all hired at GMH or GRMC. Quickly, they were given a graduate nurse certificate. And so they were immediately hired in the hospitals. I believe there's one that's working for public health, but we were very proud of them becoming mobilized. And they did their clinical at GMH for the last 2.5 years. So they know those nurses. They know what they're going through, and they wanted to help. So we've been in communication with them since they graduated, and we're hoping that they're studying for their NCLEX, but because of COVID, there aren't as many seats available, social distancing and all that.
Right.
So they are scheduling themselves to take the NCLEX, and we want them, of course, to get their RN status as soon as possible. In an ideal world, you want that in 3 months, but this is not an ideal world right now.
Yeah.
Hey, Margaret, it's Jason here. Thanks again for joining us. And I wanted to just add something and maybe say the highest praise I can ever give as someone who has been a beneficiary of the high quality. And like you said, our nurses here are unbelievably first class. They're trained extremely well. Their bedside manner is impeccable. Their compassion is undeniable and everything. And as someone who's, my father in the last 2 years of his life was probably in and out of the hospital maybe a dozen times and everything. And he saw so many different nurses, both male and female. But I was going to say, the one thing that I do know is a hallmark of any Guam nurse that I have ever dealt with is, like I said, anybody can come in and just say, you know, oh, I hope you feel better, administer some meds, you know, rub your belly, pat your bottom. But Guam nurses, they take no crap from anybody. They were like, hey, you're in here and my job is to get you better. And I'm not going to basically just, you know, just butter you up and everything like that. You are my mission and I want to make sure that you feel better. So here's what you got to do. I know you may not like it, but let's get this thing done. And I have always appreciated that.
Thank you. No, I really appreciate it. And actually, I think I've told you before, but if it wasn't for your dad, I wouldn't still be at the university because he was on the committee that had to vote for whether I'd stay or not stay as far as getting tenure. But he was always such a supporter of all the nursing faculty. And those of us that have been at UOG for a long time, you know, we really looked up to him. But it was because he understood the value of a nurse. I mean, this is not just an educational program. We've got, our students have to, yes, they have to have the book smarts. But if they don't care about people, and if they don't have high ethical standards, they're not going to last, or they're not going to be a good nurse, right?
So maybe that would be my question though. How do you actually instill in that in prospective nurses when they're going through training and everything that, you know, you must be compassionate, but you also have to be very, very firm because, you know, in our island culture, you know, older people are revered and we defer to the generation that came before us. And, you know, women are very highly revered, but, you know, you have to make sure that you are assertive in making sure that your patient, you know, does what they have to do to get better and to go home.
Right. Great question. But it's really about empowering the individual and the families, right? You know, it's about giving them the information so that when they go home, they can take care of themselves or they can take care of their family members. And so, you know, we do have a rigorous program. And I have to say, of course, we have great faculty. I mean, I'm so blessed that, I tell everyone I have the best faculty that anyone could ever hope for because they're so dedicated. And they, in addition to the faculty, our students spend so much time at clinical, and for the most part, it's been at GMH. In the summer, we started clinical at GRMC, and thankfully, GRMC has been amazing. All summer, we sent we have 40 junior nursing students, and that's a huge class. And so while GMH was in the thick of all of this, we were able to do clinical all summer with small groups of students so that it was safe at GRMC, and they're wonderful. But it's those nurses at the bedside that are really the role models for our students. And so when the students see, you know, that they're teaching a family member to take care of themselves, because, you know, once they go home, there's no nurse in the home, right? Mm-hmm. And so it's about a whole continuum of somebody's lifespan. It's not just about the days that you're at the hospital. And the nurses know that. Right. You know, we really have a program that encourages a holistic view of someone's life, a holistic view of health. And that's very important. And we see that in the pandemic. You know, we really want to encourage people to take care of themselves, their mental health, as well as their physical health. You know, people that have chronic illnesses, diabetes, heart disease, obesity, you know, during the pandemic, they're getting hit very hard. They're not the only ones, though. I mean, I don't want people thinking, oh, great, I'm healthy, and you guys are great. You had that bodybuilder guy on. Mm-hmm. You know, that's not the case. That healthy people are also being affected by the virus. But those that are diabetic or have heart disease, this is not the time to eat badly. This is not the time to forget your medications, right? And also, we need to take care of our mental health, not just you know, individuals, but also our healthcare providers. Mm-hmm. You know, all our frontliners, the grocery store clerks, right, that are stressed out.
But
because so many people are coming in contact.
you guys are out here on the front lines. You're telling people to be healthy, to take care of their mental health. But what about the nurses? How are you guys coping, and how are you guys decompressing? Because, I mean, a lot of the times you hear a lot of the horror stories. We just heard 32 doctors, nurses, staffers over at GMH who have came down with COVID. So I would think that, you know, it kind of has some sort of effect on you or a nurse worrying about, you know, their colleagues. So how do you deal with that?
Definitely. And an important part of our program is that we teach students, you know, that your mental health is just as important as your physical health. And that's been a belief of all our faculty. And you can see that you need to draw on that. And I mean, personally, GNA in Nurses Month, they highlighted on social media how nurses themselves were taking care of their mental health as well as their physical health. And this is going to sound terrible, but in March, you know, a lot of us, the nurses and everyone, the doctors, especially now that a lot of our friends are getting COVID, you know, our fear, of course, is that we would get COVID. And so personally, I mean, I've been exercising, you know, 3 to 5 days a week. That's really helped my mental stress. UOG shut down, so I got my whole office to myself anyway, so I could do that. But we really encourage even something as small, Sabrina, as taking 5 minutes to do deep breathing. That will completely calm your mind, slow down your heart rate. If I can't sleep or I have anxiety, or even in the middle of the day, you know, do a quick deep breathing exercise, and just in and out, you know, deep breath in and then out 3 times. That will really slow things down and calm things down. I used to tell the students, and we train them because when they do skills, we watch them and we critique them, right? Mm-hmm. And sometimes people will say, oh, you guys are so mean to your students. And I tell them, hey, we're nothing. Wait till they go to the hospital and their family is there watching every single move that you make, making sure that, you know, you're taking care of their loved one. Or there's a doctor there, you know, ready to ask you a bunch of questions. And so we're not mean, but I'll tell the students, okay, I can feel your anxiety, you're stressed out, you know, take a deep breath, close your eyes. You know, sometimes I'll, you know, close your eyes and think of the beach. You know, what is it that can calm you quickly, right? And so for one student was so cute. I asked them before NCLEX, okay, everybody needs to tell me right now, what is your way that you can calm yourself down quickly? Because when you're going to take that NCLEX exam, if your anxiety level is too high, you're not going to pass. But, you know, what about that time we got to do CPR on a patient? That's 10 times more important, hundreds of times more important than our NCLEX exam, right? And so one of the students was so cute. He would picture his pet cats. So whatever it takes, you know, we need to figure that out for ourselves and develop some kind of coping mechanism. And, you know, we saw the headlines, right, about suicide rates on Guam. Right. There was in the media last year, you know, they talked about the high rates of suicide among U.S. doctors. We know nurses, of course, we've got a lot of stress and with each other, you know, we're the worst. We don't ask for help. And a couple years ago, I learned that, you know, I got to ask for help when I need help. And our faculty, you know, we're a family, and the nurses at GMH are a family. I mean, we've seen that particularly recently, but we've learned that, you know, we got to call on each other. You know, last night, one of the vice presidents texted me and said, hey, are you doing okay? And it was a perfect time because I was ready to have a breakdown. I was not okay. And so, you know, every time I'm ready to quit, somebody calls me or texts me, and, you know, it's fate or faith, whatever you want to attribute it to. But, you know, there have been so many times through the pandemic, the nurses and all of us, you know, feel like giving up, but we can't give up because we're doing this for our people, you know, for our family. And so I really want to thank you for giving us the time to come on the air and really highlight that there are hundreds of dedicated nurses on this island. They are just amazing. And we do it because it's our families. And I'm so happy that Jason talked about his dad. You know, many of us, we are doing it for our families. And I don't know how much time I have, but I just want to say one thing. When my dad was in the hospital, he had a stroke, and I don't even remember what year it was, maybe 2008, 2010. And he passed away the year I became the dean, he passed away. It was very traumatic. But my mom had a stroke in February, and, you know, we don't talk about it a lot, but she was at GMH. She was one of the patients that got kicked out of SNU because they needed it for the COVID unit. Right. They were very professional. But I have to tell you, when she was in the ER in February, I really noticed a huge change between the time my dad was in the hospital in the ER and the time that my mom was in the ER, because GMH had renovated the ER. I don't know if you guys remember. Mm-hmm. And the old ER just really, you know, boy, that just really looked terrible. We still need a new hospital. You know, our people deserve better than what they have. Our healthcare workers deserve better than the building that they're working in. But my comfort was that my mom had great nurses. I could leave that ER room and know that she was going to get the best care possible. When my dad was sick, it was so hard because I'd worked in California in home care. I knew a lot about rehab. I knew what my dad was not getting. And it was killing me because I had to think, oh my God, do I move my dad off island, which, was not an option. This is not an option for people. And it's not something that we should think about. And he got the best care he could at GMH. But when he went home, he didn't get the rehab he should have had. My mom, on the other hand, had home care. She had take care. They did a great job. Now she's able to walk with a cane, and the family, we take turns taking care of her. And so she needs one person to help her get out of bed. But just seeing that change at GMH and seeing the great nurses really made me feel so grateful for, what our healthcare workers are here for, grateful for my job, grateful for the university, and more importantly, grateful for those healthcare workers at the hospital and everywhere on the island that actually take care of our students. Nobody gets paid to take a student when you're, at home care or at mental health or at public health. They do it because they want to train these students the right way, and they want the students to see and learn, from the best. And so I'm so thankful because we've only got 7 faculty, and we can't produce great nurses without all the help of the community. And so I really appreciate it.
Thank you, Margaret. I just wanted to ask, in the classroom, right? So we teaching the nurses these things in the classroom, and then going back to what you had said about some of the structural and systemic inefficiencies with our healthcare system. So when we get the nurses in the classroom and we're teaching them this and we're teaching them that, and then we put them out into the, quote unquote, the real world, and they're facing these challenges that we deal with on Guam. I mean, you said it yourself, what your dad could have got in California. So how do you teach that instinct for these guys to go out and kind of adapt and evolve and work around all these barriers that they may come across and trying to deliver the best patient care that they can? Because sometimes they have to get innovative, right?
Oh, definitely. And I used to joke, but it's not a joke, especially now, that if you work at GMH for a year, in my mind, that equals like 3 to 5 years in any other hospital. And that, in a way, it's good, in a way, it's bad. But we have, throughout the curriculum, we focus on leadership and critical thinking. And by the time students are seniors, they actually take a course on leadership and how to change policy. And GMH and GRMC have been great because we pair them up with a nurse manager at the hospital, also at Navy and throughout, throughout the healthcare system, public health, Guam Behavioral Health, and the home care agencies. And their job in senior year in our particular leadership class is that they have to focus on a change project. And I tell you, when I moved to Guam, so I went to UH, I love UH, but my change project was so lame. I was at Tripler, and my only change project was, okay, how do I get the nurses to have staff meetings? I mean, that's so lame. I come to Guam, and the leadership class, the students are helping with change projects. Great example at GMH years ago. When patients have pain, one of the students helped them develop a pain scale. There's one that has faces. There's one where, so you could, if people don't speak English, or for kids, you can say, what your pain level is. And at GMH, the nurses there help the students institutionalize and come up with a policy and actually target a specific problem. GMH is so smart that the nurse managers already know before they get the student, okay, this is a project we need help with. And then they assign the student. And the projects are so varied. And every time we have their pinning ceremony, I'll tell the students, okay, you give me the list of your projects, because when I give the titles of those projects, that is so eye-opening to the public and the families, because, this is not just education. Like you said, Chris, the students actually work hand in hand with the nurses and come up with a policy. And then GMH is so smart, they implement it. And the students will actually present to the medical committees if it's a policy regarding a particular practice that involves the doctors. Sometimes it's about assessment, sometimes it's about education, sometimes it's about an innovative new procedure or an innovative process. And through that, annually, you're able to make change. And so, we teach the students that throughout the program, and the nurses at every institution that the students go to, the nurses always ask, okay, what's something that we could do better? What could we do different? And so I think that's part of the beauty of our program, is that collaboration with the real world, as you call it.
Right on. Thank you, Doc. That's good. And you're right. I agree. I mean, I've heard nurses who work here at GMH and they go and work in the station like, man, these guys are spoiled. They got everything.
I know.
Well,
Definitely.
Thank you for coming on for the show. We're really grateful and appreciative of this partnership with the GNA. Was there any final words you wanted to depart with?
I just want to say to my nurse colleagues out there, you're in our hearts, you're in our prayers. The whole island, I believe, is behind you. Just in the last few weeks, I've had a lot of people reach out to us saying, hey, are you okay? And we've reached out to our friends at GMH and of course at GRMC. You're all stressed. Hang in there. You're doing this for the right reason. For the people of Guam. And we love you. We love all those nurses. They're our families and our friends. And to the people of Guam, thank you for all your support. Please stay home and do what you need to do. Hand washing, the 3 W's. We need your help. We are suffering, and we can't do it without the people of Guam. So thank you, Chris, Sabrina, Jason. Thanks, KOM, for everything you're doing.
Thanks, Margaret.
Again, that was Margaret Hattori Uchima. She's the Dean of the UG School of Nursing. She's a longtime Guam Nurses Association member. And she was the 2019 Guam Nurses Association Nurses of the Year awardee.
Right on.
And so this is a segment that we're going to be doing every Thursday morning right here on the link in partnership with the GNA.
Cool. Good job, Bree. That's awesome.
No, I'm just glad. Like Susan, she was really quick. Like I said, I reached out to her, and whoa, she came up with a schedule and everything.
Yeah, and this is something we've been wanting to do back since our show was called Containing COVID.
Yeah.
Okay, I also wanted to add for any nurses out there who, you're going through really, really unprecedented tough times and everything. Take a few moments and actually go through the comments while Dr. Hattori Uchima was talking. The overwhelming love and support that everybody watching the show was giving, saying, nurses are rock stars. Nurses are amazing. Nurses are, the most compassionate. Guam nurses are the best. Nurses deserve a raise. There was so much support being given to you guys. So if you are going through something right now and you're a nurse, go in there. It's going to galvanize your mission. It's going to hopefully make you feel better and give you the strength to go on and take care of us. And thank you, each and every one of you.
Thank you, Jason.
And by the way, our governor is a nurse.
Right, exactly.
In case you didn't know.
Right, you might have heard. 7:10. Let's go back to the KUAM News Zoom room. We're bringing on former 2-term Governor Carl T.C. Gutierrez, who is currently the president of the Guam Visitors Bureau. Yes, of course, we're going to touch on tourism and the economy and all that stuff with Uncle Carl this morning. Good morning, Governor.
Good morning. Morning, everyone.
Good
Jason,
morning.
Rena, and Chris.
Good morning, Gov.
Good morning.
Nice shirt. Thanks for joining us.
It's so wonderful listening to Margaret Hattori Uchima. Well, I think she's a Paris clan. I think if Paul was a dad, that she was my classmate at Guerrero Junior High. That Paris clan's always been the smart clan.
I guess let's get right into it, Uncle Carl. I want to kind of, and we'll get to the tourism and the economy, but I just wanted to kind of get your take on the current situation that we're all living under, this lockdown, where we're seeing, the spike in not just the positive cases, Governor, but also the deaths, right? And the numbers, although they are not as large as they were maybe last week, that's partly mostly because we're doing half the amount of tests. So just kind of sitting in this situation we're in now, what's your take on it as a 2-term governor? And people say this all the time, oh, Carl Gutierrez, he's the disaster governor. So your perspective is always very insightful for us. So I kind of want to give you the floor and just tell us what's your take on it when you go around? I mean, if you do go around, what are people saying and what's your feeling on everything that we're just dealing with right now in this PCOR 1 lockdown pandemic?
Well, if you can imagine that my job, GDB, CEO, and president, I interact primarily with the one side of the community that has been clamoring for opening up the businesses and get the economy going. And so that's what I hear from. And of course, I've always been put on a spot because I also try to advocate for that. And but when we see and they do have some really great arguments. Just now recently they're putting a pact together to be able to bring their voices louder to the one agency that might be able to hold public hearings and see what's going on, and if there's a better way to take this lockdown to the next level. But when you see that in the last 3 months, 15 people committed suicide, I mean, that thing has to be taken into consideration as well. And I know the governor has the hardest job to be able to take care of this island right now. So I don't want to second guess her. I know that there's a big problem in not opening up our economy, but you can't open it up unless we flatten the curve and bring down the people, that are rather get the people to understand what is going on and what needs to be done. And everybody must be willing to participate and cooperate. Because every day, 50 at least is the average from what I hear over the last week of positives. And that thing can still, exponentially grow. And hopefully that if it does happen to grow, that we all get that herd immunity people are talking about, that the entire island would be then hopefully immune to it. But it's going to take several months. And I know that with JTB, right now, they're not even booking any more flights for passengers until November 1st. So we have all this opportunity right now, and Jerry Paris and our crew who, are looking at a budget cut from $22 million to $6 million is what we're going to be operating under. Originally, it was $9 million, but we relented and allowed the Finance Committee to take another $2.9 million out to be able to balance the budget, and that for us to get that money back in April 1st when we go out there and refinance our hot bonds, which was promised to us, but unfortunately the oversight chair removed that provision to have us move forward for February reissuance of the hot bonds. And so now we're operating with $6 million without any more money to be able to work except to keep GVB open. And we're doing the best we can. We're doing a lot of things in-house, branding, marketing, and we cut off all the contracts that we have been giving out to the private sector to do that. We are now rediscovering our own talents in there that had always been there to be able to do this marketing and branding. And I look forward to this pandemic and the PCOR 1 being lifted because we have brought down and flattened the curve. And it's terrible right now that that's who we have to deal with. But we're not going to sit back and not take the opportunity to do what we can in solving the flooding problem. For example, at Tuman Bay, well, there's a downtime here, and been working closely with Vince Ariola, Jesse Garcia at Public Works. They are going to hopefully give us $50,000 to help us since we don't have those funds anymore. And it is the responsibility of Public Works to be able to take care of those situations anyway. Almost $4 million is going to Parks and Rec from our budget, and hopefully we can work together to spruce down the island, and not only at Tuman, but all the various areas that the tourists go to. Take this opportunity to do that, and with this inclement weather right now that we're facing, we're kind of slowed down, but we're not going to stop to take this opportunity to move around the assets that we have that are being covered up by the debris and trash that you see around. And I think Lieutenant Governor Josh Tenorio has really did a lot to remove some of the homeless people, and now we're not as focused on that issue, but we're making headway. And I'm just asking the people of Guam, please take heed of what the governor is trying to do in protecting this island from any further deaths, not only by the COVID, but by the depression that sets in when people are being evicted from their apartments or or just the stress and of not being able to get out of their homes. And so that's what we need to do as a community. And if there's anything that can be done, is to bring confidence out to the community. And the governor is working very hard to do that. I know that if you're a critic, I think there's a way to criticize, maybe just coming to an ad loop and speaking with the governor, because sometimes the media that spins this through so much that it riles up and polarizes the community. It's not helpful at times. Yeah, it can bring the attention to the general public and hopefully put pressure in the legislature to do something, but we've got to be able to come together. So you just drop all your animosities and let's just come together as one community. I hope that the governor can call these people in and sit down in that big conference room or Zoom. I don't know how it to be done, but we've got good mask system.
Yeah.
But we got to face each other, look each other in the eye, and know that we're heading in the same direction. We just need to be able to stop the fighting, because that's what's happening right now. The community's polarized. I've been trying to allay some fears every day, every evening when people call me because they can't move forward, and they think that I could get them to move forward
Right,
when
yeah.
my hands are tied just
Right.
as much as anybody else.
Right, Governor. That's where I want to go to next, is when you talk about the community being polarized. Obviously, on the two sides of this argument, we have, and just recently as yesterday, this action pact that was formed. We've got these protesters who are calling for the reopening of the island. But then on the other side, we see in the comments people putting, simple statements like money over lives. So in your opinion, and like you said, you hear from these business owners all the time, they think they got the in with Uncle Carl to open things up. But do you think that there's a reasonable middle ground between these two polarized sides of this economic argument?
There is a middle ground, and I know that people say that the governor went just too drastic by going from P-Core 3 to P-Core 1. But that's what she believes needed to be done. And now that we are in that last few days of hopefully having it lifted to either go to P-Core 2 or P-Core 3, that there's a way now to like we're helping right now at GVB, getting the message out and getting the community ready and understand what we need to do to be able to say, when we open up the businesses like restaurants and other places and more businesses, that certain protocols that the governor puts out will be followed. I know for most of the businesses that we're doing that, but there's just some that just don't pay attention to that. And so I'm hoping that that middle ground is this last 2 weeks that kind of shook us up, would allow those that were guilty of not following the protocol, even family weddings and family funerals, they were not paying attention as they should have. I know I went to several funerals and there were some standing outside without their masks, and I kind of avoided them, which is not the Carl Gutierrez that avoiding people, but I had to, because it was just not kosher to go there and greet them as I normally would greet people. But there is a middle ground, and the middle ground is that hopefully the governor and the business community particularly, and this new PAC group and the legislature just come in one sitting. Or wear your double mask and come in this one sitting. And when you do that personal interaction, exchange of ideas and exchange of hurts and feelings, you can get things accomplished. I mean, that's what has to be done. And I think the ones that have to drop their guard right now would be the business community. Come in and let's see the governor and let's talk and see what we can do to really actually, in a climate of agreement, come across with some ideas on how to come to the middle ground.
But the governor, doesn't she have her economic recovery panel of advisors, something like that she can talk with, or that they can kind of meet with these business people?
Right.
But that you see, the business community that are not in that economic council feel like they not getting their side of the story in. And so what we're trying to do is get that group in, and maybe they have what it takes to be able to impart to that group of economic advisors that there's a different way to do things, and we just need that sitting down. Believe me, if anything I did as governor in the past was calling everybody in one sitting, facing each other, enemies, political or competitive side of businesses, they're there sitting because whatever comes out good is for everyone. And that's where I think the first thing should come from those that are out in the community, that are adamant against what's going on, to be magnanimous enough to say, Governor, can we sit down and let's talk in a good climate of agreement.
Gov, and your last, just this response, you mentioned going back to PCOR 2. Do you know something, or is there an announcement?
No. But she's know that we do have our emergency declaration till September 30. But after September 4th, I'm sure that there's going to be a reevaluation. That's what I understood the executive order to be. Right. And today is the 3rd, right?
Yeah.
Well, yeah, I believe the 3rd. So tomorrow, hopefully there's going to be a different protocol, and that's why I'm hopeful that that soon the business community that are up in arms make that first magnanimous gesture to the governor instead of just being on the other side of the fence. Try to come across and get in that one climate of agreement area that the governor can actually seriously, sincerely listen to.
We talk about the middle ground, right? So as you said, September 4th tomorrow is supposed to be the end of this PCOR 1 lockdown. Do you think that there could be some type of gradual reopening of businesses that are currently closed after this Friday? And what type of reopenings and what types of businesses being able to operate would you support, and do you think the business community would support?
Well, I can't second guess what it is, because like just yesterday we had that 47 again, and we don't know what's today and we don't know what's tomorrow, and so it's hard to second guess. I mean, we haven't been able to get down below the 40s mark here for the last few days, so we can't say what. I know that a lot of that has been the contract tracing and groupings, but we don't know that if we open up the businesses en masse, that it would be good, or it would just exacerbate the situation.
Right, and I think that's interesting as the chief economic advisor that your comments are very guarded and cautious about reopening the island, because you kind of seem to be putting the whole public health aspect of this pandemic before the reopenings.
Because the people that I speak with, they're scared. They're fearful. That's the situation, that the miasma that's over this island is fear. And that if you don't get beyond that fear, I don't care what you want to say about opening up the economic side of our island. I mean, you don't even know whether the people are going to go out and do what the business community wants you to do and going to restaurants. If they're fearful, they're going to stay home. And we got to get that fear diminished or removed completely. That's where the situation is. So it's not necessarily that I'm just thinking about the economic side. No, that right now I'm on the pandemic side, on the health side, because people are scared. I'm scared. I'm here at home. I have a little granddaughter that I would never not see every day, and I am not going out there and risk being infected after seeing all these numbers go up. I think it's rampant out there now. It's prevalent out there. And I don't want to go out there. Even if you open up your restaurant, I'm not going to go out there, because I want to make sure that when I get home, I want to be able to pick up my little Emmy and kiss her without fear.
So having said that, Governor, I think there were 3 protests last week, and you being the hands-on governor that you are, when you see these pictures and you see these images of these business owners protesting out in the streets, did you ever reach out to any of them and call them up and say, hey, slow your roll. We need to heal first. People are out here scared. Nobody's going to go and eat at your restaurant or go to your venue. Did you ever reach out to anybody and tell them to knock it off?
Well, first of all, I think I might be out of my lane on that. I think that the governor has that responsibility, that I don't want to overstep my bounds. But they're smart enough to know that you can push all this pressure you can on the governor that you want But in reality, sit down and think. I mean, they can think for themselves. They know that even if you pressure the governor to open it up, you may not get the people that you want there. So these people are smart. They know how to protest. They know what they're protesting about. But getting the result is the key. And if you don't, relent and go and see the governor in a better setting than protesting, I don't know what you're going to prove with the protest except polarize the community. The governor needs everybody's hands on right now and everybody's input. And so let's just drop your guards and let's just go in and figure it out together. And I would be able to be, if I was governor, and I don't know whether the governor did or not, but I would face these people directly. And I've done in the past. And I'm sure she's willing to do that. But those people that are protesting and the adamant business people that are against the governor, just drop your guard, please, and see, because she's trying to do what's best for the island. And I think you should participate as well. Mm-hmm. And let's not just be, narrow-minded and in blinders that you only care about yourself, because she has bigger issues to deal with in the community.
Right. And as a former governor, Gov, when you have these very loud, very vocal, very minority groups that are protesting out there, as a governor, how do you kind of weigh those voices with maybe the majority of voices that aren't saying anything and you don't know what they're thinking? So how do you factor in elements like these protesters, elements like this action pack, when you have to make a huge decision by tomorrow about whether or not we're going to extend this lockdown, make it more strict or less strict?
Several people have come to me that are loud voices in the community that are against the protesters. But let me tell you that I had to sort of ask them to please, if you're going to go out there and parry these protesters, it's just going to bring the community more against each other and more polarized. And so, I don't know, except that the governor is not going to fight these people publicly. It's not going to do any good. I know sometimes it's hard to hold your tongue, but those that are really, really angry are the ones that need to relent. And that's all I'm asking is that, we want to open up the business community. The governor wants to open up the business community. But darn it, let's just figure out how to make it work after you open it up and not go back into another lockdown. I mean, every time they look at us from Japan, Korea, Taiwan, and even in the States, every state that are looking at us, that we keep going back and forth. I mean, like we have no darn, goal and sight that we keep going from 1 to 3 to 1 to 3. We've got to be able to just come together and I don't know what else to say except that I think the ones that need to be magnanimous right now is probably those that are really adamant out in the business community that they at all costs just open it up without knowing really the real ramifications of what the governor is facing from the other side of the health issue. Wow. But maybe if they see it, and maybe if the health people see it the other way, I think that we might prevent all this suicide that are going on and all these numbers spiking.
I wanted to follow up on something that you mentioned earlier regarding the Guam Visitors Bureau budget of $6 million. Is that what you said? Right, the $6 million.
Yeah, it was nine plus.
Down to
we
6.
agreed at 9 plus million.
What would be? What would be?
I'm sorry.
What would be your response to those who may say $6 million is still is too much, considering the fact that no one? Yeah, I'm just proposing this question. That what would be your response to those who would say that $6 million is too much because no one's really traveling, and the fact that public health, they were shortchanged or they were cut by some $3 million. So why not give more money to public health as opposed to giving?
They did. They took $2.9 million
and gave it to public health.
Well, put it in the budget, which some of it went to public health.
All right.
But they took it away from us. So we're down to just carrying through pretty much what's there right now as employees and obligations. Mm-hmm. And so we had to remove almost $7 million for the hot bonds that we have to pay. So those are the things that people don't see, but we have obligations for the TAF money. And those built schools in the past. And, what I'm not very happy about was that when we agreed to allow them to remove $2.9 million until April 1st, when we financed our hot bonds in February and saved $15 million without further exacerbating the payment schedule. I think that when that was removed because people wanted to be in a separate bill, which is going to take another 6 months probably, we've lost the low interest rate that we're facing right now to be able to do that. So, this didn't come from the Finance Committee, it came from Oversight Committee. And that's not right. I just don't see it being that way, except maybe to flex your muscle. But if you're facing something like we're facing at GDB, with less money to carry us through beyond April 1st, then you've got to step in, because we're the ones that's going to hopefully get the economy going before that time.
Mm-hmm. What are your thoughts on that then, with the fact that we talk about how healthcare is priority, but public health was gutted $3.7 million in their budget?
I don't know about that. I didn't follow the entire budget. I'm sorry, but I'm sure that my $2.9 million helped to lessen the cut.
So, in other words, you're welcome, public health, coming from Uncle Carl.
Yeah, I don't blame the government. I mean, I don't know what they did in there, but I was Ways and Means Chairman for 6 years. I was for 3 terms, and we've come to really working close with the administration, because the majority of the funds are going to the administration and the running of this island, the executive branch. And if you don't work with them and ensuring that when you think that you're wanting this cut because you want to make a political soundbite out there, that it's going to help. It's not going to help. Get the executive branch to agree to some of these things, because you're not immersed in the daily workings of public health, for example, and that cutting it down just to fit your budget, coming together and balancing out. It's not the way to do it. I mean, I've been a senator for 20 years, and I know that sometimes it's easier to just cut without knowing, but the soundbite is good. Not this time. There's a pandemic out here. The senators should listen to the governor and let the governors tell them where the priorities are in moving this island forward. Mm-hmm. Not just one piece at a time and try to make hay with that.
Gov, this is a question that I asked the chairperson of the Physicians Advisory Group yesterday, Dr. Hoa Nguyen. I told him that, people are out here, they're scared. They're watching what's happening. They're
killing themselves. They're killing themselves.
They're watching what our government leaders are doing and how they're handling this pandemic. And I asked him, are we going to be okay? Are we going to be okay, Governor?
Yeah, well, first of all, I have a lot of respect for Dr. Nguyen. And he has really immersed himself. And every time I reach out to him, it doesn't take more than a minute to get responses from him. He's very concerned. And that's the kind of person you want to listen to, Dr. Jenna Manglonia. These people have their jobs to be able to carry this island forward without dealing them a death sentence. And they're doing what's necessary, but it's hard to say. I mean, this is such a new thing, pandemic. You can't even go and face each other face to face to come to a solution on something. It's unprecedented. We can talk via Zoom or WhatsApp, but it's different. It's different than coming together. And I don't know, but I have a lot of respect for it's a diverse group, the Physicians Advisory Group. I'm never on there. I listen to these people trying to come to some kind of consensus. And it's difficult because different people have different ideas of what's going on when this pandemic is, even you got the CDC that goes from one decision to another in a matter of hours because they don't know. They don't know. They don't see the real situation except waiting for a month to see what the numbers are.
So are we going to be okay?
We're going to be okay. We're going to be okay. Just listen to the governor. Come in and provide your input to the governor in a very respectful, calm way and non-protest. Let's go in there and make your protest in a face-to-face fashion. It gets you more than jumping up and down, because we already know that the protest is out there. Just come in, be magnanimous. That's what needs to be done here. Magnanimity, if they can find that word, from both sides, and let's face it together in a better setting. And you've got to get them into that one setting. Like I said, set the climate of agreement first, that we are going to move forward positively and find the best solution for it. Both sides agreeing.
Gov, and when we brought you on this morning, one of the first things you had talked about was this increase in suicides, right? So we have this public health pandemic emergency. We have this economic crisis that a lot of people feel like we haven't even really gone into yet. I mean, people are talking about an economic desert, next year. And now we're facing what looks like, and we know because the crisis hotline has seen, the calls to the crisis hotline the increase is crazy. They used to get maybe a call a day. Now they're getting hundreds of calls.
500 to 600.
500 every month. And we're seeing this increase in the suicide. So as a former governor, how do we give these people the hope that, other than telling them, hey, we're going to be okay, how do we give them the hope? Because, we're seeing our island in so many different ways in these dark times. And to me, when you stick your finger in the air and you have the mental health professionals saying that we're just overwhelmed with the amount of people who are reaching out, who just need someone to talk to, we're overwhelmed with suicides. There's evictions going on, or repossessions. People are really hurting. So how do you give them that hope? Because, and going back to what you said, a lot of what we're talking about, what we're experiencing is fear-based. So how do you, continue to tell people, hey, we got to hunker down, we got to wash our hands, we got to stay home, we got to be safe, and it's going to be okay? How do you?
Well, I think your group here has been very, very much in the center of things, trying to not rile people, and so the polarization of the community is where the problem that forces people to do crazy things. And this morning at 3:00, I received first message asking me to help to bring families from California and one from Korea of the one person that committed suicide yesterday. And so I've been working on that thing, but it's I think that person probably was facing to be out on the streets before long, and he wasn't going to do that. But I can't emphasize this enough, Chris and Sabrina and Jason, that the governor is facing a very tough task, and she's not causing polarization. Polarization is from us out here in the community that are not happy with the decisions she's making, and that until we get together to understand that there needs to be a requirement of what she's doing, and that also we need to bring to her attention what needs to be done out here to mitigate the situation that you just brought up about people that are despondent because they can't get a job, they can't make payments, they're locked in. But until such time that we come together and not be polarized, and hopefully the media will help to sort of mitigate this polarization as you're doing. I listen to all sides. The way I listen to, sometimes somebody pops up, right? But that's out of your control. And but that's what we need to do. And the governor I'm very willing to be able to sit down with these people in that quiet setting, so we can all both come out together with one statement to the community, that this too shall pass.
This too shall pass. Be not afraid. But I just see it, Gov, with the numbers, and we have these triggers, right? The triggers that are supposed to move us from
PCOR 1 to PCOR 2.
Right.
The hospitalizations, the cases, effectively be able to do contact tracing. And I can't remember the fourth one.
Yeah, we're not meeting any of them, basically. We'd fail on all of those. So I just don't see how we could reasonably move from PCOR 1 to PCOR 2 by tomorrow. And I feel like also it's just so, it's got to be tough because we all know that if we're not meeting these triggers, we can't go back to PCOR 2. Where's the communication?
I also wonder, what are your thoughts? Do you think that this PCOR 1, what you're seeing outside, because we still see people out there driving around, is it, and we have the stay-home order, but is it really strong enough? People are clamoring about, we need just a full-on lockdown. Nobody going to the beaches, or go back to what it initially was, no one going to the beaches and all of that. Do you think it needs to be stronger?
Well, you see them because they're going to go out there and get the essentials they need to live. They're out there for the construction projects are still going on. The grocery stores are still operating, and that's where you see the people. And so it looks like no one's paying attention, but it's a good test that when you go to Payless Market, when you go to Benson, and you see everybody following the actual protocols that are set in place, they want to be open and stay open, and they are very, very much following the orders of the governor. So those people that are out there, that are out there and they're allowed to be out there, and following the protocols, I think it's a good sign for the people to know that this is going to increase the opportunity to be out and from the lockout. And so I think that we have to, I don't know exactly where those numbers are coming from, but from my understanding, it's from clusters and, from families. And so it's not like it's spreading out in the actual community.
Mm-hmm. So you don't think that we should continue to stop no one goes to the beaches for whatever a week? No one stop the drive-thrus and the takeout, ordering of food?
No, I'm absolutely not. I mean, I just know because these people that wants to stay open are following the protocol. Mm-hmm. And if there's one that slipped through the cracks because he had contracted, and not positive before the incubation period, that's very rare.
What about going back to what I had said about the communication, right? So, in a lot of ways, sometimes I feel like we're on this ride. I mean, we are on this ride where we all know this lockdown is going to end tomorrow, and I just feel like, why isn't there more communication from Adelup kind of keeping us posted? Because, I mean, here we are, it's Thursday, and so many people's lives are hanging in the balance with this declaration that we're expecting. We reached out to Crystal Pacos and Augustine, last week when they extended it. It was on a Thursday, and she was able to come on and say, yeah, so preliminarily, this is what we're going to be doing. And the response this morning was, there's no info. And so do you think we could do a better job with communicating with the public so that it's not this like, hey, everybody, tomorrow we're going to extend it for another week? Because I feel like there's a huge part of this like dialogue that the public is not getting from the administration.
The advisory groups that advise the governor, the doctors, they're all doing this on their own time. But I think that you're right. I think that there should be a sit down in some fashion to just do nothing but move this protocol forward and move this study forward and make this decision and give out an outlook of what to expect in the next week. I understand what you're saying. And, with this pandemic thing where you cannot just interact, physically, or people to make visits to the offices of the governor or to have a conference except through Zoom. Sometimes that delays things, Chris. And we just have to hopefully the doctors that are out there that are giving of their time and resources will speed up more of their meetings and add more to their meetings and add more to their studying of what's going on, so that this the decision or the advice given to the governor is more rapid and more numerous than just once a week.
Mm-hmm. Is there anything you think you would have done differently in handling this response?
No, that's second guess. I mean, I don't know. I wasn't in there to know everything that the governor has been receiving input on, and I cannot do that because I don't know. I'm only out on the outside looking in.
All right, thanks, Gov.
Yeah, thanks, Gov.
Thank you, guys. I
Anything
appreciate it, and keep up the good work. I really love listening to this program.
Thank you, Gov. Be safe. Wash your hands, and so stay home.
Safe.
Stay safe. Yeah.
I will. Take care, guys.
Okay.
Stay safe yourself.
Okay, Gov.
Please do what you can as a very, very forward front media guys. Get the people to drop their animosities and work together. That's all I'm asking you to do. Is that you can do it. You guys have a lot of influence.
Thank you,
We'll try
Gov.
our best. Thanks, Gov.
All right, we'll see you. Former Governor Carl T.C. Gutierrez, very, very engaging and interesting conversation. And I mean, I feel for Governor Carl in that I feel like there's a lot of things he wants to say, but he's also got to tippy toe
Be respectful. And
of the current governor. So that's always tough, especially because, I mean, how do you not have... I mean, he's got the experience. I'm pretty sure. You talk about the protesters meeting with the gov. I'm pretty sure Governor Carl could meet with Governor Liu, and they could just be like, "Hey, let's go try this. Let's try this. Let's try this." You know what I mean? There's so much experience there. 7:48. We'll take a real quick break, and we'll be back with more of The Link on the Breeze 93.9. Good morning, Guam.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Yourself in my KFC hot wing deal with fries.
You're watching The Link with Chris and Sabrina on TV 11. Stick around because we're next on CBS This Morning.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
Half a day. I'm Dr. Jana Manglonia, Medical Director for Public Health. We all play a role in slowing the spread of COVID-19. We must continue to stay strong and practice everyday preventive actions to keep our island safe. Maintain a distance of 6 feet between yourself and others. Wear cloth face coverings in public settings. Wash your hands for at least 20 seconds. If soap and water are not readily available, use alcohol-based hand sanitizer that contains at least 60% alcohol. Clean and disinfect frequently used surfaces. Avoid touching your face. Stay home if you're sick. Let's protect ourselves, our loved ones, and our communities. Prevention saves lives. For more information, please call 311 or check out our website at dphss.guam.gov.
When the world feels stuck at home, there are people who would love nothing more than to have a home. Disasters don't stop during a pandemic. Together, we continue to give help and hope to those in need. Help now at redcross.org.
Half a day. My name is Kathleen Fernandez, and I'm a registered nurse at the Department of Public Health and Social Services. The Centers for Disease Control and Prevention recommends wearing cloth face coverings in public settings. Don't let your guard down. Prevention saves lives. For more information, please call 311 or check out our website at dphss.guam.gov.
It's the link on the breeze. So the word from former Governor Carl T.C. Gutierrez, listen to the governor. We had a bunch of comments. Jason?
We had a lot of comments. A lot of people are actually saying, you know, what Governor Gutierrez says really rings true in their view. They're saying, yes, people should actually listen to the governor, put all political affiliations, political agendas, motives, you know, aside. Some people are actually saying, you know, okay, easier said than done. We got some people checking in. Half a day to Peting Williams from Virginia Beach. Good to see you. A lot of people were saying that, you know, the governor should be more assertive. The former governor, I should say, should be more assertive and maybe see if he can take on a stronger role within Governor Leong Guerrero's cabinet. I don't know if in terms of policy that would even be possible right now. But he did get a lot of support. You know, you guys asked a wide variety of questions, and our commenters, they actually said they appreciated the fact that he answered as honestly as he could. You were saying, Chris, right there, he showed a great deal of deference. Mm-hmm. It would be so easy for him just to
he
say,
just
okay,
didn't want to get in trouble. So
yeah,
when he comes on, he can't second guess what he calls second guess the governor.
And I could
what I call speaking from experience, and the governor's just obviously is very sensitive about people second guessing her. But you know, Mary Sis Mendiola comments, that's right, Uncle Carl, meet in a calm way, no anger or fighting. You won't get anywhere that way. Understand everyone's situation, come up with a wise solution. Listen to Governor Lou, fear is the result of the unknown. Everyone has to be cooperative. Stay home, wear a mask, keep your distance, wash your hands. Chamarita Regis writes in, right now Lou and Josh's administration needs to put aside their political sides and get all the former governors and lieutenant governors and come together as one. Come on out of loop with one mission only. Get all the executive panels together. Let's get control of this.
We said that a long time ago. Remember
Yeah.
that?
I mean,
it would be so cool to have all the former governors, lieutenant governors come together, because this
like
is
a summit of
unprecedented.
chiefs executive.
Right. Yeah, but how can that happen when Uncle Carl can't even say what he's really thinking, and Carla Branch quit watching Eddie Calvo interviews in 2018? I mean, you talk about polarized. The administration is part of the polarizing of the community.
But this is a time when you need to set aside all of the nonsense for the people.
Angel Pete Quintanilla Castro writes, and that's the problem, Chris. I can see that he has more to say, but he pick up so quick of him tiptoeing. I was expecting him to say it as it is, but it didn't happen. But he did say a lot, you know. And the thing about what I thought it was interesting that he brought up the suicides, and I feel like we need to definitely do more to address this. I feel like this one kind of got away from the administration. I mean, they're putting out these graphics about picking apart the budget.
Yeah.
I mean, and you talk about polarizing, all the energy that goes into putting out these graphics to hate on the senators and the budget. You guys could have made graphics to try and do things to help stop our people from killing themselves.
You have pandemic, a mental health crisis, an economic crisis.
Right, and Adeloop's energy is going into hating on the senators for passing a budget. I just don't get it, and that's part of the problem is this bickering. And we talk about everyone coming together. Well, even the governor has to come together. So
Even BBMR and DOA, they could have gone to these budget hearings and participated.
And which is exactly what former Governor Gutierrez was actually saying. He's like, when Sabrina asked probably the two most prescient questions is she said, okay, I asked Dr. Hohenwin a very direct question yesterday, and you said exactly, word for word what you asked the good doctors. You're like, are we going to be okay? And you saw him kind of, and Uncle Carl, he can speak from the hip, and he's always been really, really good in a press conference, like in front of the camera. He really took his time when he answered with that one, and then he finally said, he goes, yeah, we're going to be okay, but we got to put in work. And he even said, I don't want to cause any more divisiveness. I don't want to, make dissension in the ranks. And again, it could be very easy for him to draw on his, remarkable resume of everything he's done and basically again, assert himself. But he's like, I don't want to overstep my bounds. He even said, he's like, I don't want to, he goes, I'm going to stay in my lane on this one.
Right. And we had a comment here about, and talking about this suicide issue. Where's my friend Sonia had commented in here that giving people outlets available to people, someone from the wellness center can come and talk about the mental health area to help with ways they can deal with the stress in our community. Our faith side, the churches play an important role in our community, and it's just important to feel our trust. It's overwhelming, but we're all in this together. Support one another and work together, Guam. And so, that being said, 9 o'clock, we're bringing on Cassiana from UOG's Penangan Project, and we also have Dr. Christiana Whitman, who is a licensed professional counselor. She's heading up the Guam Behavioral Health and Wellness Center's Guam Focus on Life project. So our 9 o'clock hour are really going to try and get into this issue of the mental health crisis that I feel like a lot of people are facing every day living under this pandemic. It's 8 o'clock. We're KUAM FM and Agotnia, Guam right there. Okay, so thank you to our viewers on KUAM TV 11. We're going to jump on we come over to the Facebook Live feed. Of course, it's Edward R. Murrow Award winning on our KUAM News Facebook page. And coming up, we're going to hop on the Island Hopper and go over to the CNMI and check in with the CNMI Governor's Office. That's all in the way here on the link. It is The Breeze 93.9. Good morning, Guam, and Esta Jos to our viewers on KUAM TV 11.
McDonald's reminds everyone to skip the line. Download our
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
If you plan on leaving your house, don't forget your face mask. Along with hand washing and social distancing, wearing face masks can drastically reduce your risk of infection. Many people who catch COVID-19 can be contagious before they even start showing symptoms. The more people who use face masks, the less the virus can be transmitted and fewer individuals are exposed. When we both wear face masks, I protect you, you protect me, and we are both safe.
ko sinya uli di sombran saltamak etsu ita saluda antes de niga Radzał dan malak estrellas durante todo el memu a nogi distancia como kupugi palu Zangiman malak Guafi con una sughiairi preba tu la noche nai banderata gaigi pues atan fanni bandera kau esta pagua pumalapa Giluk tanu man libri Sentami ti man ko badi Fando
hear the work bell ring, and I'm marching through the table. You see the same old thing, ain't no fool up on the table, and the folk up in the bottom. And you better not complain, boy. Get in trouble with the mountain. Oh, let the midnight special shine a light on me. Oh, let the midnight special shine a light on me. Oh, let the midnight special shine a light on me. Let the midnight special shine a ever-loving light on me. You wonder, God, Miss Rosie, how in the world did you know? By the way she wears her apron and the clothes she wore, umbrella on her shoulder, wore piece of paper in her hand. She come to see the governor. She wants to free her mind. Oh, let the midnight special shine a light on me. Let the midnight special shine a light on me. Oh, let the midnight
Good morning. Good morning, Guam. A little bit of Zomacaro. The Midnight Special. 812 First Hawaiian Bank. Calvo Enterprises and ITE. It's The Link. Good morning on the Breeze 93.9. Looking at our comments here at KUM News Facebook Live feed, Caddy Pena writes in, Half a day. Again, you folks must have a big following because I get no response. I'm from Petey, born in Guam, 1960. Well, Caddy, good morning on you.
Half a day.
Hey, Caddy!
And that's interesting because my mom's family stayed in Petey in the 70s. So, small island. Good morning, guys. 637-0094. That's our number. Again, we're all over the breeze. 93.9 KUAM FM in Hagåtña, Guam. And we've also got the audio stream, Docomo Channel 10. We're streaming at KUAM.com and on the KUAM News app. And again, on our KUAM News Facebook page, where we'll start this hour. Here's what's coming up, though. 9 o'clock, we're getting Cassiana from UOG's Penangan Project and also Dr. Christiana Whitman of Guam Behavioral Health and Wellness Center's Focus on Life project. And we're also going to the CNMI in just a few minutes where we'll touch base with the CNMI governor's office and the spokesperson, Kevin Bautista. That's coming up. But first, let's do a look at the news, and we'll start with Jason Solis and your Link Morning Update. Good morning, Guam.
Here's your Guam news update. 32 Guam Memorial staffers have tested positive. Here's your Guam news update. 32 Guam Memorial staffers have tested positive during the second surge of coronavirus, and the administrator says federal help in the form of critical care nurses and doctors can't come soon enough.
As the investigation into whether or not a nurse caught COVID while she was a patient at the Guam Memorial Hospital continues, Hospital Administrator Lillian Posadas says the data shows GMH patients are safer than their stateside counterparts. Posadas saying the rate of COVID infection for patients and staff in U.S. hospitals is significantly higher than Guam's.
And it's not an uncommon incident.
Right.
So, let's not panic about it. Let's not go, oh my goodness, the hospital is not doing enough. Well, look at the data from the time that we started taking in COVID patients to now. One incident,
Right.
one
Yeah.
person. So, let's not scare the community.
Yeah. Marnette Agabao, a GMH ICU and ER nurse, did not have COVID when she was admitted to the hospital, but she was listed as the island's 8th COVID fatality last week. Posada said Agabao could have caught COVID from a visitor, and the incident is currently being investigated by the hospital's infection control team. Meanwhile, GMH staff have been hit hard by the coronavirus, with Posadas saying during the first wave, 12 hospital staff tested positive for COVID-19. Now, during the second surge, the number of infected hospital staff has almost tripled.
There's actually 32 employees. In this second wave, there are 32 employees, including some doctors who have now tested positive. So, that taxes our staffing situation because these individuals have to be out, they have to be isolated, and we have to give them time to heal and to recover.
So that means the hospital's infection control team has its hands full with full-on contact tracing underway.
The infection control team is making sure that if that staff exposed certain patients and even the co-workers within that area, they've been followed up, and fortunately none of them have tested positive.
Posadas saying the 32 staff who have COVID are a mix of clinical and non-clinical staff. With the coronavirus sidelining nurses and doctors, she says federal help in the form of DoD critical care frontliners couldn't come at a better time.
If we can use all 15 in the emergency room and ICU, that will be tremendous, because then at least we can open up more ICU beds.
Posadas adding, of the 42 COVID patients at GMH, 6 are receiving ICU level care, with 3 of those patients on ventilators. She also addressed calls to move non-COVID patients out of GMH and to GRMC, saying the private hospital can start by taking the public hospital's non-COVID telemetry patients. For Guam's News.
As for the latest numbers released last night by the Joint Information Center, there are 47 new positive cases. Guam's total COVID case count is now 1,494. Of those, more than half, 828, are active cases. 653 are recovering. There have been 13 deaths on Guam. 45 people are hospitalized at the Guam Memorial Hospital. 8 of these individuals are receiving ICU level of care. The COVID case count in the CNMI has gone up after a sailor deployed to Tinian from Guam tested positive for the virus. The sailor is part of a team of Navy Seabees supporting a survey for the Tinian Port construction project. According to a media release, the sailor was identified by travel screening and tested on arrival. The individual, along with close contacts, were transported to Saipan. The confirmed positive sailor was placed in isolation, while the remainder of the team and 2 sailors identified as close contacts were placed in the government quarantine facility at Kanoa Resort. We should add that before traveling to Tinian via military aircraft, DoD informed the CNMI government the CB team had all tested negative. This positive case brings the CNMI COVID case count to 57. And with more regional headlines, here's KSPN2 News.
President Trump is headed to the battleground state of North Carolina for a campaign rally.
Hafa-day Guam, here are the headlines for CNMI.
Today, we've sent out a little over $53.5 million.
With $9 million projected to be sent out this week to those approved for the Pandemic Unemployment Assistance Program. Secretary of Finance David Adelig says batches of payments are sent out each week.
Usually payments are sent out by the end of the week. We make that just an internal goal, but if we are able to process earlier, then we release it as soon as we.
Once the Department of Finance receives the approved files from the Department of Labor, a payment date is posted on an individual's account. But Atelig says this does not mean the individual will be paid on that date.
PUA software solution, the online tool that they have, we pull that data to start processing the payment. I believe it triggers a date on as if we paid it out. But once we receive those files, there seems to be a lot of corrections that need to be done on the file itself, meaning there's a certain format that we have to process, be accepted by the Bank of Guam for our direct deposit ACH transaction. And in order to do that, we need clean files for thousands of people that we're reviewing to get paid. And it takes couple days to comb through the data.
Then the funds are released. Many have seen a $0 amount from the Department of Finance in their bank accounts. Atalig says, don't fret, this is a trial to make sure the actual funds will go through.
It was a test transfer. Those that received 0 transactions, 0.00, that means that's positive. That means it went through a proper account. And those that never received it, obviously we know it's errors that we're trying to correct.
Atalig says those who did opt for paper checks will have to wait at least 10 days after the Department of Finance receives the data, as there are specific regulations by the U.S. Department of Labor that must be followed during the printing process. News, I'm Ashley McDowell.
The Guam Department of Labor is hiring temporary workers to help with humanitarian cleanup efforts related to COVID-19 while further preventing the spread of the virus. It's funded by the National Dislocated Worker Grant. The program is seeking individuals who have been laid off or furloughed from their job as a direct result of COVID-19. According to project manager Katrina Contreras, we need people with positive attitudes who are eager to learn and help us sanitize quarantine sites, homeless shelters, and isolation centers. With the federal grant, we can all work together to improve and change our situation. There are 20 openings for maintenance workers and housekeepers for 6-month terms. Some of the job duties include cleaning, again, and sanitizing rooms, restrooms, and hallways, temperature screening, distributing supplies, and receiving and restocking as needed. Physical distancing requirements. You can register by going to hireguam.com and upload your resume. That's your news.
Thank you, Sabrina. 8:21. We'll take a quick break, and then we're going to the CNMI. 8:22 on the link. It's The Breeze, 93.9. Good morning, Guam.
Happy Life Construction is here and ready to work.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
If you plan on leaving your house, don't forget your face mask. Along with hand washing and social distancing, wearing face masks can drastically reduce your risk of infection. Many people who catch COVID-19 can be contagious before they even start showing symptoms. The more people who use face masks, the less the virus can be transmitted and fewer individuals are exposed. When we both wear face masks, I protect you, you protect me, and we are both safe.
It doesn't get any better than this. Two of the latest, greatest Chamorro artists to come out of the Mariana, Savage K and JD Crutch. Gone with the Wind. It's the link of The Breeze, 93.9. Good morning, Sabrina.
Good morning.
I had a message here on the Facebook.
Mm-hmm.
Morning, Chris. We just want to say that we love you guys' show. It's coming from Joe Gaddison on Facebook Messenger. And we were looking to make the trip this past July, but we weren't able to due to the COVID. So we'd like to say stay strong and positive. Joe and Bertha Gaddison from Texas. They're also asking to give a shout out to the wife's family, Lester Uggan, Marie Uggan, Edward Uggan, and C. Jeffrey Uggan.
There you go.
There you go. Yeah. So shoot us a message, man. Hit us in the DM when you slide in. Don't slide in creepy. Just slide in. Okay. 825. Let's go to the CNMI. Let's slide into the CNMI's DM. Kevin, you don't mind if we slide into your DM, right?
Hi, Kevin. How are you?
Off the day. Buenas. Good morning.
Good morning.
Good
Good
morning.
morning, Bree. Good morning, Chris.
On the Zoom, KUAM News Zoom room, we have Kevin Bautista, who is the spokesman for the Office of the Governor and the NMI, where it kind of seems like they're doing way better than us. I hate to say it, and they used to bring it up in the press conferences back during the first lockdown. And man, our governor would get triggered when someone would say like, "Oh, in the CNMI they're doing this." Or sort of like, bro, it was like instant set off. She would be like, "Oh, well done." And I don't know what the history is, but I mean, we were always like, "Man, maybe you should be asking CNMI for some pointers," because damn. And I mean, that being said, though, we'll just start, Kev, with you guys had a couple positives with DOD. Can we just kind of go over that real quick, and then we'll get into everything else?
Yeah, of course. No problem. Well, thank you again, Bree and Chris, for the invitation. Bree mentioned it at the top of the show. Yesterday, we announced our latest 57th case, which was a sailor deployed to Tinian from Guam as part of the team of the Naval Mobile Construction Battalion, or the Seabees, supporting a survey for our Tinian Harbor port construction project. We had Joint Region Marianas and Navy officials who have coordinated with our task force, our governor's task force officials, to safely transport the confirmed individual and a lot of the other known contacts from Tinian to Saipan. In total, it's about a group of 14 individuals. The identified sailor who confirmed COVID positive has been placed in isolation and is now at Canoa Resort here on Saipan, transferred safely from Tinian, as well as 2 additional sailors who are identified as close contacts, and the remainder of the team are now in quarantine and are in close monitoring by our doctors and nurses here on Saipan.
Have the other sailors, though, have they exhibited any signs or symptoms of COVID? Or is it too
So
early?
far, good question. So far, nothing to report on that end. The latest update that we got yesterday on our conference call with both Joint Region Marianas and our Commonwealth Healthcare Corporation. So far, it's just one individual who is exhibiting or is showing the symptoms who tested positive for COVID but is asymptomatic. So it's just one COVID positive case and within the batch itself.
What I thought was interesting was you guys were told, though, I thought, the CNMI government, that they had tested all of these sailors prior to arrival in Tinian, and they had all tested negative. So,
What happened was...
So it's really interesting because when test results came back, we were just as we were asking a lot of questions to DOD to see if there was anyone who broke protocol, because so far from what we've reported on Tinian and both Tinian and Rota, 2 of our minor outlying islands here in the CNMI, are relatively COVID free. We've had 2 cases on Tinian in the past, but so far every time there's a case on Tinian or Rota, we would isolate that case and bring them over to Saipan for additional isolation and quarantine. But so far, Tinian remains relatively COVID-free. So we were very surprised to see that the military bubble that the DoD has informed us that they've created from Okinawa to Guam and Guam transporting over here really indicated to us that we felt that it couldn't have been from Tinian. So again, we're still having the communications and we're really doing the contact tracing with our task force, with our CHEC, with the naval public health officials to really retrace the steps to see if there was anyone who had a breach in protocol. and really making sure that we can continue to keep Tinian and Rhoda safe.
Kevin, how's the dialogue between you guys and DOD? Because it sounds like it's pretty open, which is not what we see here.
Yeah, it's to be honest with you, it's been really open. Rear Admiral Benoni and Governor Torres have consistent dialogue throughout the pandemic. We've had some really solid support from the Department of Defense throughout the course of the pandemic. They've sent over some medical officials and some nurses and doctors who have really stepped up and helped out our CHEC because, as you know, coming from the CNMI and Guam, we have this collective idea that we know that our public health infrastructure is limited in our capacity. As an island healthcare system, we don't have a lot of resources to go around. If we can't get treated here on, we can't get treated off in the mainland just because of the travel restrictions. So given the support we've gotten from DOD, from HHS, from the federal family of partners, FEMA, of course, we've been pretty rock solid in terms of our response because we've been trying to make sure that we continue to have that dialogue and open communication as much as possible. And I think for us, both with our federal family partners, with the community here in the CNMI, I think we've been doing an excellent job in terms of making sure that we can continue to keep COVID relatively contained here in the CNMI. And so far, as Bree mentioned at the top of the show, we have 57 confirmed cases only. It's a blessing. I think it speaks to both the community's cooperation here in the CNMI, which we greatly applaud and commend. The governor has said that consistently in our press conferences here on island, with the media partners across the region and some mainland outlets as well. But at the same time, too, I think the most important word that we're using for our pandemic response since January was proactive. The governor has been very proactive since January 29, making a request to FAA to cancel flights from China, and talking to the White House and making sure that we have this dialogue where while China and our Asia Pacific market is our bread and butter for our tourism industry, just like Guam, one of the biggest things we're trying to do is making sure that we protect what we have here on islands, which are the people that call the Marianas home. And I think the most important thing for us is just knowing that we can continue to have this dialogue with our federal partners to keep COVID away from the islands, because we know that even one case here on island is one too many. And I think that the governor, our chief executive officer, Esther Muña, our task force chairman, Warren Villagomez, and all of our first responders and medical workers have been working very diligently and very hard since January to keep this contained, and hopefully we're doing a good job in doing that.
So what kind of orders is the CNMI under currently right now on Guam? We're on a PCOR 1 lockdown, stay home order, so only essential businesses are allowed to operate. Essential businesses like banks, grocery stores, clinics. You can also go buy a car by appointment only.
And you can exercise at the beach.
And the parks, right?
Because you guys did have something went into effect, I want to say either last week, Monday. Not necessarily like what we have, but you guys had your own sort of order or guideline that you implemented, right?
So what is it now?
Yeah, that's correct. The governor announced on Friday, August 21st, that our COVID-19 directives have been amended for temporary re-implementation of restrictions on in-person interactions, social gatherings, and business hours to protect the health and safety of the people of the CNMI. So not as extreme as it is on Guam. Our restrictions are from Monday, August 24th through Sunday, September 6th. So this Sunday is the last day of these new restrictions, or these recent restrictions.
What are they?
So we've capped down our social gatherings from 25 to 10 in a single room or single space. We've limited our attendance at church services from 75 to 50%. Our business hours now are from 4 a.m. to 9 p.m. And we've limited occupancy in our businesses to 50% of the business's occupancy permitted by our Department of Public Works Building Code. Our restaurants have gone down to 50% as well. We've been very diligent in our enforcement to make sure that when restaurants and bars are conducting businesses at 50%, that we initiate the proper protective measures for contact tracing, which means that establishments must document the customer's name, phone number, and a log, which must be accessible to our health officials, so that in an event that a case would happen in a restaurant or a bar or in a business establishment, we would have the patron's name and number, and we'd call and conduct the contact tracing. And so far, our businesses engaged in gaming, including the casino and our video poker establishments and our e-gaming facilities, are closed except if authorized to operate under an authorized reopening plan by the COVID-19 task force and CHEC. In a similar way that Guam has with your public beaches, all of our public parks, public pathways, and public beaches are open only for outdoor recreation for the purposes of exercise and wellness, both physical and mental. And shoreline subsistence fishing, such as taladza, rod and reel, commercial fishing activities, continue to permit, provided only that it's within the 4 a.m. to 9 p.m. Guideline that the governor has implemented. We have a curfew here in the CNMI at 10 p.m. all the way up until 4 a.m. And again, this is only for just 2 weeks. Our social gatherings at. Go ahead.
Were these restrictions in place, during the longer period of the lockdown, maybe after January? So are these restrictions that the people in CNY were already used to having to adhere to from maybe like a prior iteration of the lockdown?
Yes. So what we have in CNMI, it's a little bit similar to your P-Core system, but what we have is called a community vulnerability rating level system. We do it by color coding. So at the beginning of the pandemic, we've had it at level red, where most of our stay-at-home orders, actually, technically, the CMI has actually never had a formal stay-at-home order. What the governor had implemented was just a stay-at-home guidance to inform folks in the CNMI and all residents and all businesses to stay at home as much as possible. Teleworking options are most recommended. And we wanted to engage the community's engagement with that policy. And so far, the community has been very receptive and open to those directives when we implemented them back in March, especially when you guys, Guam, announced your first 2 cases back at mid-March, I believe.
Right. Mm-hmm.
So when we got our first case on March 28th, we really went down to the nitty-gritty and forced ourselves to really hunker down, enforce a stay-at-home order, the stay-at-home guidance, and really make sure that people and human movement were limited in order to protect the safety and well-being of the CNMI community, both in Saipan, Tinian, and Rota.
I remember when you guys had your first case, it was like no flights from Guam can come in here from this date to that date. And I know people have clamored about that here on Guam about, well, we don't want any flights, shut down the airport, and, we can't because of the FAA. How were you guys able to stop flights from coming into Saipan? Did you have to go through the FAA, or did you just call United and said, we don't want you guys coming here, or what?
Yeah, it was interesting, actually. So what we did was, well, first off, just for context, a lot of our commercial flights, beyond just United Airlines, which is our only U.S. carrier, are our airlines catered to our tourism market, and a lot of them pulled out naturally without any force of hand from us requesting the FAA, with the exception of just the China flights. But our Japan flights, our Skymark Airlines, they pulled out organically just because of Japan's restrictions. Then our Korean flights slowly rolled back and canceled their flights. So all we were left was with our lifeline, which was just United Airlines, our only primary U.S. carrier from Guam. What we did was Governor Torres and our Commonwealth Ports Authority contacted FAA and had an honest conversation with United Airlines in the middle of April to stop flights for for the month of April, and then resumed them at the beginning of May. So we've had this So we had this conversation with United Airlines and FAA towards the beginning of April, and then we canceled flights for the remainder of April, and then resumed it back in May, just to see how far widespread community spread is within the CNMI. And we were able to do that properly, because we were able to see both through our contact tracing efforts, through guidance from our public health officials and our doctors and nurses, and anyone and everyone within our COVID-19 task force, to see how far widespread the community transmission was, because we saw that a lot of the COVID threat was happening, unfortunately to say, happening a lot from Guam, port of entry from Guam, via Hawaii, via the mainland. So, and to this day, again, unfortunately, just given our connection, I personally have family in Zigo. A lot of our family, a lot of people here in the CMI have family in Guam and in Hawaii, but unfortunately, a lot of our COVID cases here in the CMI have been travel related and have gone through from the mainland to Hawaii and then through Guam, and then we would catch them at the border here, because we test at the airport here immediately upon arrival, and then we also do a 5-day testing during quarantine.
So what? You tested the airport?
Yeah.
Everybody that comes in gets tested at the airport. Is this like a rapid test, the South Korean test?
Yeah. So it's those 60,000 South Korean test kits that we received, that we procured from Sojant out of South Korea back in April.
And now those have the EUA now, right, from the FDA?
They do, yeah.
Right,
the emergency use authorization was granted, I think, in mid-May. I remember when we got those test kits. I know we made waves within the region about getting those 60,000 test kits. I think Governor Torres took a lot of flack for that, but I think, as objectively as I can be, that was one of the most important decisions he's made as a governor, as a governor for this COVID response, because the most important thing for us was that we wanted to have surveillance both at the airport and within our community-based testing, and having the test kits not just from South Korea but also the Abbott test kits that we're getting from CDC and from the mainland helped out, and so far we've been doing as best as we can.
I mean, it paid off. You're right.
I think we've
You guys did take a lot of flack, and Kev, there was so much talk about these test kits on Guam, and it was like we didn't want them, right? But what ended up happening, you put them on ice. That that EUA came through, and now you're sitting way prettier than we are.
It's still, again, it's a partnership. The governor has been very clear about this from the very beginning of the pandemic response. He personally wants to thank Governor Leong Guerrero at the very beginning, because DPHSS collected our first batch of specimens when we were first starting out with the response. Before that, we were sending specimens all the way to Atlanta at the CDC for COVID testing. And for, back then it was Linda DeNorsi and DPHSS and Governor Liu, and that governor-to-governor contact, they were able to collect our first couple of specimens. And I think the governor's been very grateful for Governor Liu at the beginning of the pandemic, and they continue to have a close relationship moving forward as best they can.
How were funerals handled in the CNMI?
Good question. Our funerals at the very beginning of our pandemic response, around March, we were very enforcing with social distancing. We still are, especially with the church services now down to back then it was initially at 25% of occupancy for the churches. Now it's at 50%, and folks have been really good at social distancing. I don't know, just like Guam, we're a very Catholic community here, but I think people have taken upon themselves and the personal responsibility to, while they're going to church and praying, they're watching themselves closely as well and watching their distance. For funerals particularly, funerals continue. I think just living in an island community, we can't avoid funerals. It's a fact of life. But I think we've been really good at making sure that we maintain the integrity and the respect given to funerals while maintaining proper social distancing, but not restricting them altogether right now, because so far we're not seeing as much community spread within those events.
Right.
Mostly we're seeing it within our clusters that we're identifying quickly at the beginning of the pandemic, and then isolating them accordingly first before releasing them back to the community.
Kev, I wanted to follow up on something you mentioned earlier regarding military personnel support that you guys had received. Can you go into that a little bit more? These are military nurses and doctors. When were they deployed, and was there an ask that was made by the governor there that, we need help? And is it
yes?
Is it temporary, or it's permanent, or what? And is it through FEMA?
It was a temporary deployment. Yeah, it was a temporary deployment between April and May. The governor, through the Defense Civil Authority, it's called the DISCA, the Defense Civil Authority Agreement with DOD. It's the same type of civil authority joint partnership that we've had when Super Typhoon U2 really devastated us back in 2018, where Joint Region Marianas, U.S. Indo-PACOM, and individuals from the Guam National Guard were even here to help us with our typhoon response. So in a similar fashion, through this authority and partnership with DOD, the governor was able to request DOD for additional medical support to help both our doctors and nurses. They were helping us with our testing. They were helping us with doing contact tracing, and they were helping our CHEC just on the logistical side, because we know that COVID-19 has been a logistical nightmare for everyone, both economically on the public health side, from a governmental perspective, and everything else in between. So yeah, they've been really helpful in that regard.
How long were they there for? Are they still there?
I believe they're not here anymore. They were here for about a month, I'd say. They helped us get open our medical care and treatment site, which is a kind of like an annex to our Commonwealth Healthcare Corporation hospital, as well as our alternate care site. So these two external facilities were created and planned out by our governor in coordination with FEMA and our task force to accommodate for any spikes in COVID-19 cases should that come up. One of the most important things for us was making sure that we had enough beds, we had enough ventilators, we had enough equipment on the island of Saipan to accommodate the needs for the three islands, and just in the event that a spike in cases were to happen.
Is this the tents, the FEMA tents, what is it?
Field medical stations?
Yeah. Are those still up? Are they still up?
They're still up. They've been up. Our medical care and treatment site tents outside of the hospital. And next week, the governor is going to be handing off the alternate care site at Kanoa Resort over to our hospital, which has currently 40 ICU beds, 75 ventilators, and a mid-level care site. And we're handing that off next week to the hospital doctors and nurses to continue the COVID response. Because, again, I think, just for context, why we were trying to be as proactive as we can be as a Commonwealth was FEMA projected in that same projection that Guam got. FEMA projected that we would hit 8,500 cases by June if we didn't implement any protective measures within our community from the onset. And what we did was we took that seriously. We had the dialogue with FEMA. DOD was in those initial planning phases as well, with those same batch of doctors and nurses that came on board that we were just talking about earlier. And we're now in a position where we're not at 8,500, we're at 57. And I think that we're very fortunate not to see a spike in COVID cases, but at the same time too, also making sure that we continue the 3 Ws and the social distancing that we've been imploring people to do from the get-go.
Kev, how instrumental do you believe community mass testing was for the current COVID situation in the CNMI?
Oh, it was huge, for sure. That's a great question. Community testing, I think we were the first territory in the Pacific to do community testing the way that we did. So far right now, we've tested about a quarter, more than a quarter of our population, about 25%, more than 25% of our population so far. And what that meant for us was that we were able to really see how widespread the transmission was. And we were able to identify clusters really quickly, and then isolate those individuals and take them away from the overall community, put them in our quarantine sites, take care of them, give them the medical attention they need, and then move forward with additional contact tracing for any auxiliary contacts and other close contacts. So I think for sure, community testing has been very beneficial for the CNMI. Yeah, I mean, we just got to give props to the governor for really going out and taking the flack at the beginning for getting 60,000 test kits from South Korea without an FDA approval. It was a very proactive decision, and it turned out wonderfully for us. And I think that we're very blessed to have that proactive leadership, and as well as our Commonwealth Healthcare Corporation really leading the way in terms of our public health response.
Go ahead, Ray.
No, go ahead.
I just wanted to ask, has there been any requests from our island here on Guam to the CNMI for help with, nurses or anything? Because as we're, experiencing a shortage.
In terms of personnel, I don't think we've made, we've had that dialogue when it comes to transferring nurses, but I do know that because we understand the gravity of the situation down in Guam, I know for a fact that we've sent down some supplies, or we've redirected supplies that we've ordered as a Commonwealth through FEMA, and then we talked to FEMA and consulted with them to direct those particular supplies to Guam first, and then we'll just wait in line since we've developed our sort of version of the National Strategic Stockpile. So we call it our Commonwealth Strategic Stockpile now.
Right. So
we've developed that type of stockpile to ensure that we have the PPE, medical equipment, and medical supplies on hand.
Right.
Just last week, we announced that FEMA awarded us $10.9 million for the reimbursement costs for that. And then we have about $40 million. We have $40 million in the pipeline coming under review by FEMA for our other medical needs that we've had to incur during the COVID response.
So what were some of those
for us? I was like,
what were some of the supplies that you directed FEMA to give to Guam?
I believe we consulted with FEMA to redirect some medical equipment and some medical supplies. I don't know too much of the details, but in some of those consultations, we redirected pretty much just medical equipment and medical supplies through FEMA over to Guam, and we've already because we feel that Guam needs it more than we do right now, and understandably so.
So have you guys, just tell me the truth, Kevin, have you guys been looking at what's happening over here on Guam, saying, "Holy Mac, get it together"?
Holy Macaniti! Easy there, Kev. Easy, bro. Easy, bro.
Oh man.
Feels like you guys are like, man, I feel bad for those guys over there.
No, I don't want to. I don't want to make it. I don't want to dramatize it too much. But
No, please do, Kev.
But no, for us.
But yeah, really, you guys were, huh?
Yeah. I mean, at the end of the day, we have to, right? I think that for sure, our governor, our task force chairman, our CEO have looked at our entire region as a whole. Where are most of our cases here in the CNMI coming from? And we're seeing it happen. We're catching at the border. We're conducting the travel history. They have to fill out a declaration form on our governor's website, and we find out that they originate from the mainland, through Hawaii, through Guam, that classic United route, and then coming over here, and as well as some of our medical referral patients or some family and friends who live on Guam, who are over here, or who come over here, and we see that too. And we're being very careful and very cognizant of the fact that we see spikes in cases across the mainland. We see spikes in cases in Hawaii. Hawaii themselves got into a lockdown around the same time you guys did.
Right.
And then you guys busted out PCOR 1. We had to also be as proactive as we can be as well, and implement the temporary restrictions that the governor implemented about a week and a half ago, and so far we're doing the best we can to really measure out how far widespread it is.
So the answer is yes. You look at Guam and you guys are like,
Yeah.
man, whoa. Bueno. Kev, let me ask you this. So what's the current protocol for people coming from Guam going into the CNMI? I'm talking about airline travel.
For sure. So for non-resident travel, any non-residents coming in from off island, they immediately go into isolation and quarantine. But then what's great about our quarantine measures is that we make it was important for us to quarantine returning residents of the CNMI and quarantine them for free at our hotels and designated facilities. But for non-residents, those individuals have to pay about $400 during their stay. And turns out that's been a very good deterrence for any non-resident traveler that has wanted to come here to CNMI for travel or for business. But so far it's been working. We have a lot of individuals who conduct business on Saipan who are based in Guam. Those individuals have to apply for an essential worker status and quarantine at our sites, and that's been both a deterrent so that we're able to advocate for more teleworking services where they can work from Guam. We have the consultations between our Guam partners and the CNMI so that we can continue to just keep folks out there where they need to be, out there away from the borders, and making sure that we can continue to look out for the folks inside the borders here in CNMI.
Out there, huh? Out there.
So that's what we are, huh? We're out there.
No, it's not like that. I mean, at the end of the day, it's one Marianas, bro.
Hey, that's it. Reunification. No, Kev, I was just wondering because you're talking about your strategic stockpile. Are there considerable amounts of a piggy, ice keki, and blueberry bread in the CNMI strategic stockpile?
Man, I wish, man. Our business, I really wish we had that on stockpile. You know, business have been tough. I mean,
Yeah.
I was listening to Governor Gutierrez earlier in the show this morning, and just like what he said about the tourism industry and our small businesses, we've been hit hard. You know, fortunately for us, I think, and I can't say this enough. The governor can't say this enough as well. He is really commending our community for really adhering to the directives and being patient. We haven't seen any protests in the way that we're seeing it on Guam or anywhere else in the country. Governor Gutierrez was alluding to it a little bit. But at the same time, too, we know the realities of the economic impact here in the CNMI. If I can pull up the numbers here really quickly for you guys, we got impacted really hard pretty much since February, since we closed down the China flight, which is our second largest market. And our economic impact so far for our fiscal year 2020 budget was reduced by 48.3%. And then we're projecting a loss of about $100 million in government revenues within this current fiscal year. And our Department of Finance has preliminarily estimated the overall economic loss to be about $600 million to $700 million due to the loss of the tourism industry and the impact on domestic spending and small businesses. And this is only a preliminary estimate. So we're truly living in unprecedented times. But at the end of the day, we're trying to continue to work together as a community, support local, support small businesses, continue to work together, and really make use of all the federal assistance that we're getting through the CARES Act. We're really watching iteration of the CARES Act, whether it be the HEROES Act or the Republican package that's going to happen. We, right now for us in the CNMI, we're just trying to focus on what we can get and any type of assistance, both through the pandemic unemployment assistance, through our economic disaster loans, through PPP, and everything else in between. I think that's been very helpful for us as a community, and we can help mitigate the economic losses with that federal assistance.
Kev, could you touch a little bit on, because I follow you guys and also follow Delegate Khalili on Instagram. How would you characterize the dialogue, the cooperation, the communication between the governor and the CNMI and the delegate representing the CNMI in Washington, D.C.?
It's been at the end of the day, the dialogue is meant toward a collective goal, which is making sure that we can get every type of federal assistance available for the CNMI. And this requires us working diligently with our congressional office, regardless of politics, regardless of any bickering that is it's been well documented in the past for us. I think I can just, speaking on behalf of the governor knows how important this is to him, knows how important it is for us to remain proactive and to go after every type of federal assistance available through the CARES Act, through congressional appropriations, through federal grants, through OIA, Department of Interior, and making sure, and HHS and FEMA, and making sure that we can work and give the data over to our congressional delegate so that we can push it through in Washington. And just like it is on Guam, we only have congressional delegates. They're non-voting members of Congress. They have weight on the floor, or they have weight in committee. So having that dialogue within the committees, getting the pork barrel within federal legislation, and making sure that we can get that money home to the CNMI, to the territories, and making sure that all the territories get their fair share of the COVID money that's going around the federal government. To us, that's important. And I think, going back to your initial question, Chris, about the relationship between the governor and the delegate, for us, regardless of what's happening, what has happened in the past, we need to put that aside and continue to work together for the people of the CNMI. And to us, that's the most important thing.
That's pretty inspiring. That I mean, we track the history with the governor and Delegate Khalili, and it has been contentious. But I think it's inspiring that in this pandemic, those differences have, according to you, for the most part, been put aside in the spirit of cooperation and working together. And that's definitely something.
And to
someone,
help the people.
right, and the people. And someone put in the comments, there's a lot we can learn, and I think that's one thing we could definitely learn from our neighbors to the north.
So thank you so much, Kevin. Hopefully we can check in with you again maybe next week.
Yeah.
See how things are going over there.
Oh, for sure, definitely. And I actually just spoke to the governor yesterday. We'll definitely try to get him on the show.
Right.
Most likely hopefully by next week.
Okay.
Most likely next week.
Let's do it. Yeah.
Well, thanks a lot again, and stay safe.
600 Harmon Loop Road, Deleon, Guam 96929. You could put, KU care of Chris or Sabrina.
Blueberry bread.
Blueberry bread.
That's the one that I really like.
Oh, for sure.
The problem is that none of the rest of us that work here are ever going to see any of that.
I mean, it is what it is. As a gesture of goodwill between, as island neighbors, we'll send you some to Nancy after you send the blueberry
sure.
bread. Yeah, got it.
Oh, no, definitely.
Hey, put some of those test kits in there, too.
Take care.
Yeah. Thanks, Kev.
Yeah, we'll just massa, guys.
Okay, all the moss. Okay, Josh. 904, Kev Bautista.
Great job, man. Great job.
That was
You
fun.
guys are-
Yeah. We and with Tomas Manglona, we had him over here for the summer.
Yeah.
He went back to school, but we really did have a lot of in-depth CNMI coverage with Tomas. And, of course, we've continued that with our partners in KSPN. But, we were talking, it's like we kind of want to feel like they're just right over there, and we don't, it's like a tale of two, it is a tale of two islands.
Yeah, it really
I mean,
big glaring differences.
I got friends in the CNMI, and I follow them on Instagram, and I'm like, where the hell are these guys at? Is this what? I want to go to CNMI.
Yeah.
But,
good job to CNMI. Hopefully everything,
He's a really good PR person.
Oh, yeah, Kevin?
Very,
Yes.
very good.
Yeah, that's good. 9:05. We're going to take a really quick break. And as we told you, kind of dedicating this hour, and, obviously we'll do it again throughout the month, to suicide awareness. It is
Suicide Awareness Prevention Awareness Month.
right. And so we're going to talk with Cassiana from the University of Guam. And then we'll also bring on, in a little bit, Dr. Christiana Whitman, who is a doctor and also a licensed professional counselor who heads up the Guam Behavioral Health and Wellness Center's Guam Focus on Life project. Again, very alarming numbers coming out from the Office of the Medical Examiner about suicides and an increase. And it's just very troubling news. Former Governor Gutierrez, I think, very eloquently spoke on this. I think that's, something we're not hearing about from Guadalupe. And frankly, I'm just disappointed that the conversation that they're putting out is hating on this budget and hating on the senators, and they got all these fancy graphics to demonstrate their criticisms. And I feel like we're going to use that much energy on that, then we definitely have to dedicate more time and energy on addressing the very real mental health crisis and the mental health issues that are facing not just people who are traditionally in those vulnerable categories, but it's spilling over to people who don't normally deal with these kind of things. As a heavy weight of this pandemic. This is something we talk about all the time, Bree. And we'll go into it next. It's 9:06. The Link, The Breeze, 93.9 KUAM FM in Agotni, Guam. Good morning, Guam.
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafaday and Mabuhay, I'm Ann Pobutsky. I'm the Territorial Epidemiologist for Guam. Wearing a face covering protects you and those around you. We know that COVID-19 can be spread by people who are not showing symptoms, which means they are asymptomatic. Because Guam remains at risk for significant community spread or transmission of the virus, it is a necessary precaution to wear a face covering when you are in public. Everyone must wear a face covering when they leave home, have it visible at all times, and put it on when they see others nearby. Face coverings are required for everyone when shopping at stores, seeking healthcare, and inside the workplace. Covering your face reduces the chance that you will unknowingly infect someone else if you are carrying COVID-19 but have no symptoms. Prevention saves lives. For more information, please call 311 or visit our website at dphss.guam.gov.
When the world feels stuck at home, there are people who would love nothing more than to have a home. Disasters don't stop during a pandemic. Together, we continue to give help and hope to those in need. Help now at redcross.org.
You're watching The Link with Chris and Sabrina on TV 11, but don't leave yet because we're coming up next on CBS This Morning.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
everything.
9/11.
The always, any day. 'Cause heaven can wait another day. Heaven can wait. Heaven can wait. Heaven can wait. Heaven can wait.
Heaven can wait. 9/11. It's the link on the breeze. 93.9. Let's go right over to the KUAM News Zoom room where Cassiana Regis is standing by. Morning, Cassiana.
Good morning, Chris. Morning, Sabrina.
Good morning.
I know that we had you on back when it was called Containing COVID, but if you could just introduce yourself to the audience and the program you're with and the kind of a little bit about the work you do, and then we'll just get right into why we have you on this morning.
Of course. So my name is Cassiana Regis. I'm a graduate student at the University of Guam, and I'm here in my role as a student program assistant at Ipanengan Campus Suicide Prevention Program. So we're the university's suicide prevention resource facility, and we provide all the suicide prevention services to the campus community and the broader island community as well. I'm also here to let everybody know about our services at ISA Psychological Services Center. So we are the prevention program under ISA. So ISA is our main facility.
Right, and I follow you guys on Instagram, and man, it kind of got away from me that this month was Suicide Prevention and Awareness Month. But I saw that you guys had started posting what I thought was a really interesting campaign, and we're going to pop the pics up while we're talking, Cassiana, and it's something along the lines of "Be the One to," right? Is that the campaign that you guys have?
Yeah. So earlier this week, we launched Be the One to campaign. So we wanted to do it in time for Suicide Prevention Month, which is this month in September. And so Be the One to is actually the National Suicide Prevention Lifelines campaign that kind of gave the message to spread the word about actions people could take to prevent suicide. So last year we adapted the Be the One to campaign for the university to participate in, and now since we've launched it online, we're able to have the island community share as well. So how we adapted it was that we wanted to provide the community with ways they can prevent suicide and how they can reach out and know what the resources are in the community. But we also wanted to hear the stories of how people have prevented suicide, what they've done to reach out to someone, to help someone who is suicidal, depressed, or going through a difficult time. And so if you visit our Instagram, you'll see that our campaign has specific steps. So It came from the National Suicide Prevention Lifelines Be the One to campaign. So the steps are the same. Be the one to ask, be the one to keep them safe, be there, follow up, and help them connect. And that's usually what a lot of us try to do. We try to be there for people, ask the question, and know what the resources are out there so that people can get the help they need, especially during this time. So we wanted to engage the community in this conversation because in the last couple months, and especially in the last couple weeks, it's been really challenging for the island. The cases have been rising. The stay-at-home order is a lot more strict than usual than before. So I know that many, many people are going through so many challenges, so many difficulties. And so we want to make sure that everybody knows that we're available. Resources are available for anybody who needs them. And so Ipanengan and ISA Psychological Services Center are one of them.
So are you guys seeing, when we spoke with the Guam Behavioral Health and Wellness Center, they were talking about how they went from just like 30 calls a month to 500, 600 calls a month since the second surge. Is it something that you guys have seen too as well? A lot of people reaching out to you guys?
Yes, ever since the pandemic in March, and especially in the last few weeks, we found that many people are seeking services, seeking counseling services, psychological services, and just some sort of support during this time. We find that people have a lot of worries, concerns, lots of fears with the pandemic and the cases, and everyone's concerned about the health and well-being of their family. And so we've seen many people seeking services with us too.
Cassiana, I wanted to go to some of the graphics that we popped up here. And on you guys' Instagram, there's one, be the one to ask. If you think someone might be considering suicide, take the first step and be the one to ask, are you thinking about killing yourself? You also have be the one to keep them safe. If you ask someone if they're thinking about suicide and they say yes, Take the second step and be the one to keep them safe, separate them from anything they're thinking of using to hurt themselves. It also goes on, be the one to be there. If someone you know is thinking about suicide, take the third step and be the one to be there. Listen to the reasons for feeling hopeless and in pain. Listen with compassion and empathy, but without judgment. And I wanted to ask, because it kind of seems like everybody that I know is just struggling, dealing with this pandemic, with the lockdown. Like you just said, there's just so many aspects from, I'm right, we could die, we could get COVID. People are getting evicted. They can't pay their bills. People are struggling, you know. So it kind of seems like a fine line from talking to people who are just struggling with this and differentiating those people when you talk to them from other folks who are having just a harder time and thinking about a suicide. So I think it's really key to reach out and not just talk to people and check on them, but also to listen to what they have to say, right?
Yes, of course, because I think like right now it's people know that, oh, you have to stay positive, you have to like self-care, but it's also important to know, to hear people's stories and give them that sense of understanding that they're being heard, because a lot of people are experiencing different types of emotions. So we're not just focusing on suicide and suicide prevention, but many people are feeling anxious, they're feeling scared, depressed, they're very lonely and isolated. And so hearing their stories and just seeing where they're coming from, hearing where they're coming from is the most important part of all, because you can say anything you want, but if someone doesn't feel heard, it's probably not helpful either. So just being there and asking and just being so immersed in their stories is the most important thing.
What's the age group of the people that are calling? Is it just a wide range of people? Are we talking about little kids or older manamko that are calling?
That's a good question. We serve a wide range. We serve the whole age, all different ages. So we have parents calling in for children. We have adolescent-centered therapy for teenagers that want to talk. We also serve adults, so not just the students at the university, faculty, staff, and their families, but adults from the community. We have different ages, so old and young. We have families coming in, so all our services are still, we try to keep them as accessible and convenient for everybody during this time. So we make it available by phone, we have video sessions, and we have text sessions, because we know that children also need someone to talk to, teenagers need someone to talk to, and sometimes the best form of communication for that age group is texting. So we try to adapt the different types of services during this time, because nobody's able to come in right now. Right. And so it's been helpful for many people that have come to our center.
Can we just give out the numbers real quick, Cassiana? And how people can get a hold of you and work together, because we're getting some comments on that, and then we'll get back into it.
Of course. So, you want me to give the contact information?
Yeah.
Okay, so you can reach us at ESA at 735-2883. You can also email us at isa@triton.uog.edu. So all our services are supportive, client-centered, confidential, and free of charge. And this is not only for the university community, but the broader island community as well. So if anyone is needing services, you don't need to worry about anybody knowing about your services or paying any sort of fees. So everything is free and confidential. And so we have a wonderful team of counselors that are available and ready to serve the community.
Cassiana, I wanted to ask, as someone and with the groups you're with, you guys are right on the front line, right, of this suicide issue. So when you see the numbers and they're high, and it's because of this pandemic, at what point do we say that it's a crisis?
That's a good question. I think it's always important to think about too, because the numbers in the last couple of years and even now, they're pretty concerning, because suicide is a big issue here in our island, and I think that it is something, it's always been a crisis, right. And we've always tried to advocate for that and let people know, because it is important to talk about it. And we don't really talk about it a lot, and so it needs to be a normal part of the conversation too. Like, it's normal to feel scared and feel these overwhelming feelings, feeling really, really down, and even feeling suicidal. And so it doesn't help when we try to push it aside or keep silent about it. So I think just starting the conversation can help with that crisis too.
Cassiana, can you share with us? I guess you said that you guys receive phone calls and from various age groups. Could we just start with the children? What are some of the stories that they're sharing with you about what they're experiencing and what they're scared of? And then what do you tell them?
So in the last couple months, we know that all the schools have been having classes from home. All the kids and all the teenagers have been at home and doing their classes online. And so that's not always easy. That's the same thing for our university campus. Our students, both from elementary all the way to college, they need that support. They need that camaraderie with their classmates and with their friends. And so just being stuck at home is not always helpful for some students. They, just like all of us adults, they find it lonely too. It can be very overwhelming. And so they need somebody to talk to. They need that support. And so it's similar worries and concerns that we all have as adults. Mm-hmm. Children and teenagers and university students are feeling the exact same way.
Right. We had a comment here from Bev who writes, is there any information or guidelines to help us kind of ask or recognizing signs for those that just don't show any or those who don't speak out for help?
That's a good question. There are those cases where sometimes we're never really sure what's going on because someone's really good at hiding those signs that we're always like trying to focus on all these warning signs. But I think that's where be the one to be there and ask and keep safe and just following up with someone, even if it seems like everything's okay. Because even when things are going well, we still want people to know how we're doing, and we still want to be there for people. So just because things are good doesn't mean you don't need to ask how someone's doing. Like, right. How are you? How is everything going?
What would your advice be to parents? You know, I got a 17-year-old son, and you know, and talking with a lot of my peers who are also parents of like teen kids, there's a point where they go from like being your child, your kid, to like they're in that in-between phase where they're becoming young adults, where, you know, maybe dad is not as cool as he used to be. But I think a lot of parents struggle in trying to keep those lines of communication open, and it's every parent's worst fear to not, have that relationship with their kids where their kids can say, hey, I'm really struggling with this. Hey, this is what's going on with me. So how important is it for parents to have that conversation? And I do it with my oldest son, and it was awkward. It was like he turned that corner, and I was like, hey, what's going on? Is everything okay with you? And he's like, yeah. But you're right. You got to be the one to ask, because you never know who's suffering in silence, and it could be your own family.
Mm-hmm. Yeah, of course. A lot of kids and a lot of teenagers have a different way of communicating, so they're not as vocal. They don't speak up as much. So I have younger brothers, and then my sister has kids, and we see that with our clients too, with the teenagers and the kids. And so sometimes it doesn't have to be straight up. It just requires a lot of patience. And so it's not even just asking sometimes too. It's just kind of giving that presence that you're there, and if you ever need to talk, so it doesn't just have to be like out of nowhere, like, oh, are you okay? So. Right. Yeah. Yeah, it'll come naturally. It should come naturally so that it doesn't feel as like in their face.
Yeah, it's just different nowadays. I mean, when I was a kid, there was just absolutely no privacy. I mean, my mom could go in my diary. She knew everything that was going on with me because she was a single mom who was just, and had to be. And I was a troubled kid, right? But it's kind of different now. Like, I mean, sometimes I do reach that point where I just want to like snatch my boy's phone and be like, what the hell's going on in here? But you kind of want to respect those boundaries. In order to let them grow with kind of the confidence that they need to navigate this crazy world that was crazy even before COVID.
Mm-hmm. Yeah, and now more than ever with students, with kids and people going to school, we need to be very patient with them. They need a lot of patience, because for those that didn't have classes that suddenly went up online, it's not easy for them. It's very, very difficult, and it's probably one of the main challenges that people are facing. So elementary school students, middle school, high school, college students, the transition to online world is not easy. It's really not.
What are some of the questions that you ask, or some of the things that you tell your callers?
What did you say? Sorry.
What are some of the questions that you ask or tell your callers?
we just ask them like how they're doing. We always do check-ins about the pandemic because we find that especially in the last few months and the last few weeks, a lot of the worries and the concerns that people are coming in for is because of COVID-19, whether it's financial issues, worry about the health and well-being of their families, the stresses about transitioning to online learning. Lots of people are struggling with their jobs, like they're either being laid off or reduced hours, or they just have to take a break from their job because of the pandemic. Even just being an essential worker is very, very difficult to deal with as well. So there's so many different reasons that people are coming in.
Cassiana, can you take us through the 5 action steps that are part of this program? Communicating with someone who may be suicidal.
Okay.
This is on the Be the One to website.
Okay. So we have a few steps that we got from the National Suicide Prevention Lifeline campaign. So Be the One to has the following steps. So be the one to ask. If you think someone might be considering suicide or is feeling down or if you think they're going through a difficult time or it just like they seem like they haven't really been talking about what's going on, take the first step to ask. So not just are you thinking about killing yourself, but how are you doing? What's going on? Do you want to talk? So it could be any question. We phrased it in a way where it matches suicide and suicide prevention. And so the next step is to keep them safe. And so if you ask someone if they're thinking about suicide and they say yes, take the second step and be the one to keep them safe. Separate them from anything they're thinking of using to hurt or kill themselves. And keeping them safe doesn't mean just taking away the means that they're going to use to hurt or kill themselves, but just being there. Don't leave someone alone. We find that the best form of suicide prevention is just being there for someone multiple times. It's not just one session a week, but we're able to text our clients like once or twice a day and check in with them. We can have multiple calls, and I think that's probably the most convenient thing for many people right now is that we're a lot more available through telehealth. So keeping them safe means staying connected with them and checking in on them, not just once, but multiple times. And people appreciate that. The next step is to be the one to be there. If someone is thinking about suicide or is going through a difficult time, take the third step and be there. Listen to their reasons for feeling hopeless and in pain. Listen with compassion and empathy, but without judgment. And that's especially true because you want your feelings to be validated. You want your story to be heard. And when someone kind of gives you like a moral reasoning, like, oh, you shouldn't feel this way, or you're so lucky, I don't know why you're feeling this way, it's not helpful. So just being open to listening without judgment is very, very important, and being empathetic, because even though we're doing services through phone and video and text, you can still get the sense if someone doesn't really care, if they're not really listening. So being there is very important too. And then be the one to follow up. If someone tells you they've been thinking about suicide, or they told you that they are going through a difficult time, don't forget to follow up, because it can make a difference. And that's what I said earlier about checking in more than once. Like if you can, text them every day, text them, like it doesn't have to be like a whole day, but just showing them that you're available and just because they told you the story a couple days ago doesn't mean it's not a concern for you now. So just being there and following up. And then finally, just helping them connect. So know what the resources are available in the community. East Psychological Services Center is one of them. Ipinangan Campus Suicide Prevention is one of them. And we have the Suicide Prevention Lifeline, Guam's 24-hour crisis hotline. Just knowing what is available during this time is especially important, because many people think that everything is closed, but we're still here. We're still here to serve the community. And so if anybody ever needs to talk, we have counselors ready to do that.
Thank you, Cassiana. Just one last question here. Joe writes in, if you know someone who's depressed, may need help, can we call your office to have you call them?
Yes, of course. We can always work out a plan to reach out to that person. So we have people, in the past, and even up to now, we have university professors and staff reaching out to us and saying that they're concerned about a student. We have friends calling in for their friends. And so we work with those people to reach out and serve that person that needs help.
Well, thank you, Cassiana. We got Guam Behavioral Health and Wellness Center, Dr. Christiana Whitman coming up right after you. So I just really wanted to bring you on and kind of reintroduce the work that you guys are doing to the community. I know we touched base back in containing COVID, but this thing just won't end. So.
Hey, Chris. Oh, okay.
Yes, Jay.
And Cassiana, I just wanted to pass a message along to you because obviously there are a lot of people watching you now live on Facebook who are greatly appreciating your information and, the fact that you are so learned in this topic and you care so much. One person in particular, and you probably see where I'm going with this, from the Agana Heights Mayor's office is saying, Jason, that's my daughter, Cassiana. Please let her know her mom is, and then in all caps, so look at that. Is so proud of her. And then she uses every single emoji which could be considered a positive emoji. She's got the heart, the prayer, and then the smiley face with all the hearts around it and everything like that. So you have made your family incredibly proud. And what you do for the community is amazing work. So thank you.
All right.
Thank you. My mom's my biggest fan.
Right on. Thank you, Cassiana.
Thank you, everybody.
Okay.
Bye. Wash your hands.
Yeah.
Bye.
Stay home. Okay.
She beat you to it.
Yeah, she did. 9:32. It's the link on the Breeze 93.9. We're going to take a really quick break and come back with more of the show next. Good morning, Guam.
The Variety Taco 12-pack comes...
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Half a day. My name is Chimamba Kwem, Tuberculosis Enhancing Disease Program Manager for the Department of Public Health. As Guam continued to deliver critical services during this unprecedented time, we must do everything in our power to protect the health and safety of our people. Continue to encourage wearing a face covering, practice social distancing and washing hands. These practices are becoming especially important as we begin to reopen our great island. Prevention saves life. For more information, please call 311 or check out our website at dphss.guam.gov.
You're watching The Link with Chris and Sabrina on TV 11. Stick around because we're next on CBS This Morning.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
That was that.
Hey, yeah, that's little Tanapo
we're
featuring
That's all you get.
Tanapo featuring Sabrina. At 9:35, it's The Link on the Breeze 93.9. Let's just get right into it and bring on Dr. Christiana Whitman of the Guam Behavioral Health and Wellness Center, the Guam Focus on Life project. And good morning, Doc.
Good morning, Chris. Good morning, Bree. Thanks for having me on this morning.
Of course, and well, also just you're also a licensed professional counselor in this. So this branch of Behavioral Health and Wellness Center that you head up, this is specifically dealing with suicide on Guam.
Yeah, so I actually am in the prevention branch of Guam Behavioral Health and Wellness Center. And my specific project is the Guam Focus on Life Youth Suicide Prevention Program. And it's actually, Guam has had this grant in the past, but we just got awarded it again earlier this year. And it specifically focuses on youth and young adults from 10 to 24 years old, but obviously, we look at the bigger picture of prevention in terms of preventing suicides on the island. And I actually got on board with Guam Behavioral just in the beginning of the summer, actually. I was prior I was at the University of Guam in the counseling department.
Right.
But my training is as a licensed professional counselor, and now I'm at Guam Behavioral.
Can we start then with the numbers, because we hear about it, but what are the numbers with suicide on Guam, and are these young kids or?
Yeah, so unfortunately, those numbers that I think that have been released, we haven't gotten that data. The official data that we report on is, or receive the reports on, is annual data. So we probably won't see the 2020 report until early next year. So I can't truly report on that, but kind of to segue or to add to what Cassiana mentioned earlier is that it's not a surprise that suicide is an issue on Guam. It's been an ongoing issue on the island. In 2019, there were 31 suicide deaths by suicide. And that was a lower number than the year prior, but it's still not, it's still not good enough. So we continue to do the work in prevention to hopefully minimize these numbers and someday get to zero.
Right. So, Doc, the numbers last year we had 31, and I'm just thinking if we have a whole federal grant that deals with the age group that you're working with, that's the biggest demographic that's taken their lives, Doc?
Actually, from last year, it was the 20 to 39-year-olds. So it's the young adults, really. And I'm glad you had Cassiana and the Ipanengan program on the show earlier, and I was listening in. We do a lot of work with them also in conjunction with, as partners. And they're doing a lot of that work in terms of partnering or reaching out to the college age students. We also do work with Guam Community College to identify some of the gaps in their services and how we can continue to improve or increase services. But yeah, we are seeing it. And then even with Suicide Prevention Month, we're trying to figure out what are the best ways to kind of reach that demographic of 20 to 39-year-olds. Yeah. So,
I mean, this is like kind of a loaded question, but why are people killing themselves?
Very loaded. I don't know. I mean, I can't. I don't even want to begin to speculate on that. However, I will say that the best form of prevention is in getting help. That's suicide is definitely preventable, and that's what we want to highlight in the branch. And as a result of our grant, is that with help, there's hope. And the hardest part, I think, for anyone dealing with any difficulty is getting that help, initiating that step, because it takes a lot of courage to do that. It's not something we talk about all the time.
Right.
And so I was catching the end of your discussion, and asking Cassiana about how do you talk to your kids. And I think that's the biggest thing, is we start talking to them and making mental health an everyday conversation. Like I said, I taught at the University of Guam, and one of my classes, I kind of start with asking my students about their conversations at home, with regards to mental health and with regard to suicide. And in a counselor preparation program, I think in 15 students, there was only 1 or 2 that said that they actually were kind of talked to, about these issues. It's not culturally, right? It's not something that it's not exciting to talk about, right? So I'd say that would be the biggest step in prevention, is having the conversation and making it, normalizing the process of getting help and assistance,
Right.
even when it's not, go ahead, sorry.
No, I was going to say, I'm glad you say that, because oftentimes in the media, it's one of those things where when somebody commits suicide, we kind of don't report on it and we don't talk about it. And yet we still see numbers that show that maybe it's time that we stop acting like it's taboo, and you're right, normalize it. We talk about it. So I'm glad that you said that, because it's always been difficult for me, like, no, we shouldn't put that on the news, but it's happening so frequently that.
And I'm glad you said that, Bree, because there is actually, for the media partners, there are kind of guidelines for safe messaging with regards to reporting on suicide. And, along with not wanting to sensationalize suicide, we also want to always encourage people to seek support and seek the resources. So like I said, us just sharing what resources we do have is a huge step. And again, I thank you for giving us this platform to reach so many people and remind them that there is help and there is assistance available. I guess I just want to kind of add is, on a personal note, I think people think that you have to be really, really sick in order to receive services, or you have to be kind of at that space of crisis in order to make a phone call to the crisis hotline, and you really don't. We're all going through our own stuff at home, and during training, when I was training the hotline workers, I kind of used a personal example about getting into an argument with my partner about wanting to go to brunch when people are when some of the guidelines were restricted, and it seems very superficial, but it was interrupting what I had known as my normal, my normal routine of things going on in my life. And so it was causing me to be a little bit anxious. And so just kind of normalizing the idea that right now we're not in a state of regular crisis. And even if we weren't in a pandemic, the hotline can be used and can be accessed for just wanting to have, some of us don't have regular support systems. And so let this be your first, kind of support system.
Doc, I just, when you talk about a personal note, I have a friend that had someone in their family who was evicted, and this man took his life by drinking a bunch of, bug poison. And my family, we had a nephew who hung himself. So when I asked you why do people do this, I only ask because that's the number one question on the loved ones who are left behind. They always ask why, and a lot of times they don't know why. So what do people say when you counsel them and they reach out for help?
Yeah, it's such a heavy topic, and it's even more difficult to talk about because there are those unanswered questions, and so we're left hanging. We're left not knowing, and unfortunately we'll never know the answers, right? Because we don't we can't unfold. And so I would say for those people who are left, kind of left behind, those survivors of suicide, the supporters of the person who died by suicide, is they really do need bridge to also, seek assistance if they need to. And I guess I would tell them, yes, maybe it was preventable, or the issue was preventable, but it's also we don't want to repeat something like that again. So maybe we can start to kind of have these courageous conversations about how to move forward without holding on to that kind of guilt of a suicide happening in a close circle of yours, because that's what happens, right? To the people who are surviving or who are left behind, is we start to feel like, what could we have done more? What could I have done? And I would say, what can you do is start to have that conversation with those you care about now.
And I think that's why it's so tough for a lot of the family members and the loved ones who are still here trying to make sense of it, because it really comes down to, what could we have done? Well, we could have talked to them, and to know that what you could have done was just so simple and could have made that difference literally between life and death. I mean, it's a heavy burden to bear for those people. I mean, not even considering what the people who kill themselves are going through, right?
Yeah, it is a heavy burden to bear. And like I said, I don't think the overall message is that we don't want you to feel like you're bearing that burden alone. Right. And so as a experience or dead by suicide, we would want you to also get the support that is needed. And so the hotline is available 24/7. I know you had our hotline staff on a couple of weeks ago, and they're ready, and willing and to talk and be there, be that frontline support. For them also, we do offer them support, the hotline workers. So I actually offer kind of like weekly office hours, debriefing sessions to our hotline workers to ensure that they're also not burning out from being that frontline provider. Because it is a lot, even as the caller, even though they're anonymous and we don't know who's calling, it's a lot to hear those types of heavy issues. And we're all going through different experiences on our own also.
What about the training? So you mentioned you train these hotline volunteers. Are these just people like entry level people? And then can you tell us a little bit about the training? And then when you talk about having the open office hours, right? So Bree and I were just talking about this before we brought you on. I mean, it's one thing the people calling the crisis hotline, but for these volunteers to just hear these things, all day, it's got to take a toll. So there you go. What's the training like, and what do you counsel them when the people who answer the phones need the counseling?
Yeah, who counsels the counselors?
Right.
Yeah, so absolutely. So the training. So in March, I guess prior to the the lockdown and stay-at-home orders. Well, again, this is stuff that was discussed when Helen and Sylvia were on a couple weeks ago. But we anticipated that there would be a lot more people needing services and needing assistance and needing that 24/7 access. So so we kind of redetailed people to work on the hotline. So these aren't always social workers or always counselors, but they are trained to provide hotline assistance, similar to the way we train people when we engage them in the we would regularly do the holiday hotline. So it's similar training to that. There's always a social worker available though. So if the caller calls in and maybe needs additional services, we can actually provide the intake over the phone immediately. So they don't need to come in, or, that doesn't need to be interrupted. If they decide it necessitates and they would like additional services. And then I've been going in so that started in March, and we have multiple people on the hotline shifts every day. And we actually increased capacity in the amount of people who would also do intakes throughout the day. So because in anticipation for this kind of second surge of need, I went back and kind of retrained a lot of the workers. We looked at some of the gaps maybe that we were having and some of the kinks in the system, and we kind of retooled and then we also started to offer these open kind of office hours that I lead, and they're just real again, they're optional, but they're open, sort of a virtual support group for the frontline hotline staff. We recognized, I recognized in the training as I was going through the training that they really needed that additional support, right? Because it is a heavy to bear.
Christiana, there may be somebody out there listening right now, out there at home, and they're feeling lost. They're feeling stressed out because they're not going to, they lost their job. What would you tell them right now?
I would say take a deep breath. I heard Dr. Margaret say that earlier, but it's so powerful. Just this, take a deep breath, and think about maybe what would today be about? What would you want to, what's keeping you here right now? And I think if you don't have a caring contact or a support available to you, then 647-8833 or 8834 is our hotline, and there are available caring supports who are willing to talk with you. And again, there are so many things going on right now that we don't want to, we want to make sure that people know that there is help. And again, we want to make sure that people know that you don't need to be at the space where it's already kind of maximized. You're already in a spiral to be able to get the assistance. I've utilized counseling services at different points throughout my life at various transitions, whether it was in grad school or preparing to be a mom or, different things. And it's always been a very helpful kind of tool for me to, or an outlet. So I guess to normalize that that process is really important.
DACA, and again, when we talk about normalizing, there's just something, because I know people who have lost their young children. I'm talking teens, early 20s. And when you hear the reason, like some of the reasons I hear are they were fighting with their girlfriend.
Yeah.
Right. And this is just so tragic. And I've had this talk with my kids, because I think the young, when they have their heart broken, especially if it's the first love or whatever, they don't have the context to put it in, and or the coping skills, and they just feel that. I mean, we've all had our heart broken, and yeah, you do feel like you're going to die, but a lot of people don't know that you can get past that and you can keep living. So how do you, as a parent or as a Nino or Nina or auntie, because a lot of times our kids can't even talk to the parents, they want to go talk to Nino or Nina, you know, how do you have that conversation with your kids, especially when they start getting into that age where they're going to be dating, they're going to be, you know, checking people out? How do you have that conversation? Like, if this goes south, boy, and your heart is broken, it's not the end of the world. And I mean, it's not, we're laughing about it because it's like young kids in love, but it's so tragic because
it's true.
People have lost their
Well, we've all been there. We all know what that experience kind of feels like, right? To feel like this was the end all be all, and you know, this was supposed to last forever. And we've probably been on all different spaces where it didn't, it didn't last forever. So I would say, you know, as that kind of supportive contact, is that you want to validate that what they're feeling is okay, though. You know, that feeling, whatever feeling of heartbreak, of sadness, of, you know, is real. It's real to them. And just because we maybe 15, 20 years later realize that there's someone else out there, or there's kind of a way up, you know, they don't know that experience yet. So I think validating their feelings is really important. And then also kind of recognizing and checking in with them about, you know, kind of how bad is this making you feel right now, and being comfortable and confident in about either guiding them to assistance if you're not comfortable talking about it, or just asking them the questions, you know, is this making you so sad that you are considering suicide right now? You know, is this, and that's a very serious thing, and let's get the assistance that you need to be able to for that to not happen, you know, because but what happens oftentimes is that, you know, because it's not kind of a normal part of our conversation, and suicide is kind of scary, and we don't know how, we're afraid that we're going to say the wrong thing, or we're afraid that we're going to promote, you know, the suicide, we start to step away from that. And then what happens is that the person who we're close with maybe doesn't trust us enough to be able to handle that, you know, and so they might say, oh shoot, you know, Auntie T, she doesn't want to talk about, you know, she keeps kind of switching subjects. I don't think she wants to talk about this with me, you know, like, but if we're, you know, open and honest, like, hey, you know, it sounds like you're really, really sad about this, and I'm concerned, and suicide is really serious. Is that something you're concerned about? Then they know that you're ready to work with them, and you're ready to hear their story, and you're ready to hear, you're ready to continue to be there, like Cassiana said, to be the one to get them that support along the way.
And that's so key. I mean, I got, you know, everyone knows I got kids, but I've had that talk where, man, this is going to happen. You're going to love someone. You're going to be with someone. You're going to think it's going to last forever. You're going to get your heart broken. It's going to hurt. Yeah, it's going to hurt. It's going to be real, but you live another day. And I think just saying that, I mean, if you're just like in the dark and your kids are out there doing whatever and they get their heart broken, you don't want to be that. I mean, it's so tragic. You don't want to be that parent who's just sitting there, like we had said, asking why, and then you go on the phone and they were fighting with their chick. It's just, I mean, no one should have to come to that place. We just got to talk to people.
Right. You know, and connecting with them it's so important. You know, we keep using the social distancing term, and I don't want to say it bothers me, but it does a little bit, because, you know, we're not trying to social distance. We want a physical distance, but we really do want to continue to maintain connection, even if it's virtually. At the same time, we want to be able to watch there really is Zoom fatigue, or, you know, kind of online fatigue, right? And so, I mean, I was feeling it this morning, and so just, you know, be mindful of that also.
Would you say we're dealing with a mental health crisis on Guam?
I'd say that we're all, I mean, I don't know if, I think it's an ongoing crisis, you know, until we, like, if we're thinking about suicide, I think we would want it'll continue to be a crisis until we're at zero, right? I mean, that's in my opinion. In terms of our mental health capacity, I think we've been able to see this people, get the support that we've been needing. Guam Behavioral Health did get a couple of emergency COVID grants as a result of the pandemic, which has allowed us to hire a couple more counselors and social workers to support the increasing maybe need of the community. But yeah, I guess I don't know if that answers that question directly.
I just asked that because I know in the past suicide has been described as an epidemic on Guam.
Yeah, it has been. And like I said, I think 31 is still, it's a lot, it's too much, and so we really do we need to focus on that prevention side and try to really, continue to do the work that we're doing. I think the Suicide Prevention Month is this month, and there's going to be a bunch of different things going on, even virtually.
Right.
And so I think you'll be getting a calendar soon, and maybe we can talk about that
Sure.
at another time. But as we don't want to lose sight of the fact that, it's definitely an ongoing issue. And until it gets to zero, I don't think it's not going to be an issue.
Yeah.
No, we agree. Doc, thanks for coming on. And again, anytime, because we know it's Recovery Month too. Are you involved?
Yes.
Right.
Yeah.
So we want to definitely get behavioral health and wellness on the recovery side, but with the Focus on Life project and everything you're doing, keep in touch. And anytime you need to get the word out at all, we'll give you the floor and we'll put you on. Okay.
Yeah, we really appreciate it. Thank you so much again for all the work you're doing. You are also frontline workers, and so if you need support and help, the hotline is available to you also, and we would like to get you guys the support you need.
Thank you, Doc. Well, while we got you here, there was something. I'm just kidding. You're gonna need like a couch. You're gonna need the couch.
You need a couple hours for this.
And then we'll do it. We can.
All right. Thank you,
Thanks,
Doc.
Thank you so much.
Okay.
You guys have a good day. Be
All right,
safe.
take care.
Wash your hands, stay home. There you go, Dr. Christiana Whitman.
We need a whole.
I
another
got
4
a
hours.
friend. You see, I got a friend, and he's
asking for a friend.
right, asking for a friend. Right on.
No, but really, if
Yeah.
you need somebody to talk to, the number is 647-8833. 647-8833 or 8834.
Right, and then also, talk to your friends, talk to your family. I mean, in our culture, there's a lot of we don't talk because the shame and the guilt, and we don't want to, burden people with what we're doing because we know they're going through a lot. But you gotta reach out and you gotta ask people. I mean, it's just so simple. Yeah. How was your day? 4 words can save somebody's life. Okay. Hey, good job today, Sabrina.
Good job, Chris. Good job, everybody.
Joe, sir.
Joe.
Ken Sanity. Hi, Ken. Ken, I want to say hi to you. All right, on.
How you doing, Ken?
You doing okay, Ken? Joe, sir, you all right? Bree?
I'm all right.
I gave you Dr. Whitman's number. Jason, good job today, my man. Finally got you your microphone.
Thank you, by the way.
Yeah.
I do want to say something. We had that shout out to Castellana from her mom who works at the Agana Heights Mayor's office. She said she greatly appreciated that. And the mom had been watching since earlier in the show when we were doing our emoji breakfast challenge. She goes, the Gannett Heights Mayor's office is going to try and see if we can get you guys some actual breakfast.
Wow.
Oh.
Thank you again,
Nice.
guys.
Yeah, we're going to eat that with our blueberry bread and our piggy from Saipan.
Okay, I got the ice cakey, though.
Yeah.
That's
okay.
mine.
Yep. Yeah. Okay.
Thank you actually to all the guests that came on.
Right.
Great interviews.
Yeah, and also to Master Control and Kengineer. And remember, we got your 6 with the KUAM news team and the primetime show. This has been The Link on The Breeze 93.9. And thank you most especially, of course, to all of our listeners on the radio, those watching the TV stream, the audio stream, and the Facebook live feed. Thank you guys so much for joining us. And let's do Friday tomorrow. We're anticipating some kind of announcement about the status of this current lockdown. Remember, it's supposed to end tomorrow, but
right. But if the numbers haven't been looking so great,
and I don't think anything's going to happen today that's going to suddenly miraculously, change things.
So you might as well just prepare. We're probably going to stay in this lockdown.
Right. Just so you know. So
and let's do it right. Stay home, please.
Make it count. Okay. It's 10 a.m. We're KUAM FM in Agatnia, Guam. I'll leave you with this little pick-me-upper from our friends at Anetnungef Palgus and Guaiza How Guahan. Good job, Bree.
Good job.
You guys be safe, wash your hands, stay home, and of course, ask people how they're doing and tell them that you love them. My name is Chris. Adios!
You got this, Guam.